This is the committee's first virtual forum. While we had hoped to conduct this meeting in person, we have to follow the guidelines from public health officials who continue to advise that physical distancing to protect ourselves, our family, and our communities is necessary to prevent the spread of COVID-19. This forum will provide committee members the opportunity to discuss the impact of COVID-19 on the districts and share solutions to address the pandemic as they pertain to the committee's jurisdiction within the areas of education, labor, and health. I'm going to recognize all members in order of seniority, alternating, of course, between the majority and the minority. When members are recognized, they'll have 5 minutes to provide remarks. They're not obligated to make remarks, and they're not obligated to use all 5 minutes. We don't have a clock, so we're kind of on the honor system, but if you go over, I'm going to try to keep time, so try to keep it to 5 minutes. Once we go through the list by seniority, I'll go back through and call on those who did not respond the first time in order of seniority, in case some joined late. Members who missed their turn will be moved to the bottom of the order. That said, if someone gets disconnected while they're speaking, they'll remain in the queue. When they get back, if they'll indicate between speakers that they've rejoined, they can be recognized again where they left off. We're able to, well, like I said, we don't have a 5-minute clock, but members are asked to watch their own clock when they're speaking so they can find their full remarks within the 5 minutes. And I'll try to intervene if people kind of go over. With that, myself for 5 minutes for my opening statement. Today, we're gathered to provide all members to share how the spread of COVID-19 are affecting their districts and discuss what the committee can do to provide relief. COVID-19 emergency is disrupting nearly every facet of our society. More than 30 million people have filed unemployment claims. Students and families are confronting the consequences of school and childcare closures. Business owners are struggling to cope with an unprecedented economic pause, and many of our constituents are at risk of losing access to health care during this global pandemic. Our response, the committee has to focus on 3 key priorities: maintaining students' access to an education, protecting workers' access to paychecks, and expanding access to affordable health care options. The Families First Coronavirus Act, the CARES Act, the Paycheck Protect Health Care, both important bipartisan steps in the right direction. To preserve access to education, the CARES Act included $31 billion in emergency funding, which will help K through 12 schools and institutions of higher learning cover priorities like sanitizing classrooms, purchasing education technologies, and supporting students. As a result, my state will receive about $238 million. The colleges and universities in my district will get about $46 million in emergency relief. At least half will go to supporting the students. The governor will have an additional $67 million to meet educational needs across the Commonwealth. We also included support for public broadcasting. This is so that program institutions like WHRO in my district can provide courses that students can take to keep their minds active. WHRO has content for virtually all of the required courses, and people can go online to get those courses thanks to WHRO. We created a pandemic EBT program to provide emergency food relief to families and allowed the Department of Agriculture and school districts to continue serving meals to students who rely on them as a source of daily nutrition. We also designated additional funding to reinforce emergency food providers like food banks, food pantries, soup kitchens to keep families from going hungry. To help essential workers and low-income families access early childhood education, Congress provided $750 million for Head Start, $3.5 million for childcare providers, And for student loan borrowers, we halted loan payments and interest accrual on all federally held student loans for 6 months. To support workers during this 2 weeks of emergency paid leave to as many as 60 million workers and 12 weeks of job protected leave, 10 of which are paid for workers caring for a child whose school or daycare has closed. For workers experiencing layoffs, furloughs, and reduced hours, including so-called gig workers, we expanded unemployment insurance by $600 a week in addition to state unemployment benefits. To ensure access to urgently needed health care, we secured no-cost coverage for COVID-related testing and vaccines under all insurance plans. We also provided $1.3 billion in emergency funding for community health centers, which serve 28 million people, including 3.5 million for centers in my particular district. These legislative packages are helping address some of the most immediate needs, but it is clear that we must pass additional legislation to provide our constituents the meaningful long-term relief they need. The next legislative package must include urgent financial relief for states and localities. According to the Center on Budget and Policy Priorities, state budget shortfalls could reach $500 billion or more. If we fail to help state and local governments cope with this shortfall, it'll have devastating effects on public services, especially education. Before this crisis, Virginia was planning to give teachers a modest raise, hire more school counselors, provide more funding for high poverty schools, and freeze public tuition at public colleges. These actions are now indefinitely on pause, and without federal support will probably just evaporate altogether. The next package also must include additional relief for child care providers, K through 12 schools, and institutions of higher learning, which are facing a tidal wave of new expenses and the threat of imminent budget cuts. We also have to reinforce career and technical education. While the CARES Act dedicated $345 million to support dislocated workers, that is simply not enough. As states across the country, reopen, we must ensure that state and local workforce systems have the resources to address critical shortages in frontline jobs and help workers get back on their feet. Today, I'm going to be introducing the Relaunching America's Workforce Act, along with a number of my colleagues, to get money out of our state and local workforce system to help employers prevent layoffs, get into new jobs, and support training for placement in new positions, especially healthcare workers, direct care, and frontline workers. We also have to protect worker safety. OSHA needs more authority to pass enforceable regulations, and we hope that that takes place. We also have to consider COBRA benefits and no-cost coverage for COVID-related treatment. And finally, we have to make sure that all health care is protected. And my colleagues, this unprecedented emergency demands an unprecedented response. As I've said before, we should not view COVID-19 response bills as economic stimulus. It is disaster relief. And so we look forward to working together to address the needs of our constituents. Thank you, and I'm now pleased to recognize our ranking member, Dr. Fox, for her statement. Dr. Fox, are you unmuted? You have to unmute.
I'm on.
You're on.
Thank you. Thanks, Chairman Scott. I want to say good day to everyone, morning or afternoon, and also send my greetings to our colleague, Mark DeSagne. I am so glad to hear that Mark is recovering well, and hope that we'll all soon be back, and that he will be with us. Our nation is facing challenges in ways we've never experienced before. The American people are looking to us, their elected representatives, for guidance, leadership, and timely action. This is not the time for partisanship or political theatrics, but a time for us to come together and do the work we were elected to do. Safeguarding our public health and reviving our economy are not mutually exclusive. So during today's discussion, I'm eager to hear about the work being done on the front lines in everyone's districts, and proud to share that the workers and small businesses in North Carolina's 5th District are doing their part to combat COVID-19. We're all aware of the growing importance face masks play in containing the spread of this virus. Hickory Springs Manufacturing, HSM, located in my district, is doing its part to ensure our community is well equipped. HSM is a supplier of components for furniture and bedding industries. However, the company recently made an emergency capital investment in equipment to produce protective face masks and medical gowns for healthcare personnel on the front lines of this pandemic. Mr. Michael Henshaw Jr., Chief Operating Officer at HSM, noted that he is, quote, beyond proud of how our company's worked tirelessly over the past several weeks to get this new operation up and running in an incredibly short time frame. These efforts demonstrate HSM's values and reflect our family culture and our employees' sense of duty to help our country. However we can. I certainly join Mr. Henshaw and the entire 5th District in applauding HSM for this brilliant and patriotic initiative. Likewise, in Winston-Salem, North Carolina, a group of 200 volunteers has come together to create Project Mask WS, a mask sewing project dedicated to creating masks for medical personnel and frontline workers to combat the N95 mask shortage. So far, this group of selfless volunteers has distributed 25,000 masks to healthcare providers, recruited thousands of helping hands, and raised more than $25,000 to buy supplies and mask materials. The masks are now being used by a number of facilities and doctors' offices, including Wake Forest Baptist Medical Center, Novant, Davie County EMS, and Salem Chest Specialists. These stories of Americans helping other Americans are inspiring. Congress and the Trump administration are doing their part too. While Congress has passed significant legislation to help families, workers, and small businesses suffering from the health and economic consequences of the coronavirus, our job is not over. We need to make sure the legislation we've already enacted is working properly and the funds we've approved are spent properly. In order to do so, we need to continue to hear from people on the ground about what is or isn't working. More importantly, we cannot keep throwing money at this pandemic, and we shouldn't pursue partisan pipe dreams that have nothing to do with combating COVID-19. We also need to protect businesses so they can reopen and operate safely for both workers and customers without being threatened by frivolous lawsuits. Additionally, as our states begin the initial phases of reopening businesses, schools, and the economy at large, it is my firm belief that Congress should follow suit and lead our country by example. The hardworking Americans of this country need to see members of Congress conducting the work they elected us to do. That's one reason I'm in my office in D.C. today. That is why I support Leader McCarthy's call to establish a clear, safe, and effective plan for reopening Congress. As Leader McCarthy said last week, quote, conducting the business of the people's house is the definition of essential work, end quote. I'll wrap up by saying we're no strangers to comeback stories. America's economic engine is not down for the count. Every day, Americans are stepping up. The private sector is helping lead the charge. Americans helping Americans, neighbors helping neighbors. We'll defeat COVID-19 together. Again, I thank all of those participating in today's discussion and look forward to hearing from committee members. Thank you. I yield back.
Thank you. Thank you, Dr. Fox. Susan Davis, gentlelady from California.
Thank you very much, and thank you, Chairman Scott and Ranking Member Dr. Fox, for our distance learning launch. The coronavirus crisis has brought multiple inequities in our education system to the surface, and we need to face these issues head on. We absolutely cannot bury our heads in the sand and pretend that this pandemic will pass without long-lasting impacts. All the educational research says that the biggest indicator to a child's success in school is their relationships with their teachers. Going online has created a new problem in that students have gone, quote, missing. That means that they aren't checking in online. And there are a myriad of reasons that this could be happening, including computer or connectivity issues or home issues that prevent the child from attending. Without face-to-face interactions, it is really difficult to assess how students are feeling and to provide emotional support. Back in my district in San Diego Unified School District, where the San Diego Unified School District has really been a leader in distance learning.
Hey, yes. We appear to have lost Susan. We'll try to get her back. In the meanwhile, we'll go to the gentleman from Tennessee, Dr. Rowe. Phil, are you there?
Mr. Chairman, can you hear me?
I can hear you now.
Okay, thanks, Mr. Chairman. And Ranking Member Fox, appreciate you doing this. I'll try to be brief today. And thanks for holding this. I look forward to when we get back in person. I want to go over just a few things I think that have popped up in my district. One is in the PPP with small colleges, that if they count their student workers that are on work study, each one of those is counted as an employee, and it puts a lot of them over the 500 PPP account, and they can't access those funds. I wish what we would do is count it as FTEs. If a student's working 10 hours and there are 4 of them, that's 1 FTE. So that's one thing I think we could do to help our small schools. Secondly, on our school lunch program, those are supposed to be self-funding. In my area in rural East Tennessee, the school directors and most of the folks just decided to feed the kids. And many of them package this up and take the food actually with volunteers to their homes. But it's costing them a lot of money, and and it's really put a strain on their budgets. So if we could help in some way, and I think Susan was getting this, Congresswoman Davis was getting this direction when we lost her, was much of our school year has been heard. Our schools now, public schools, have completely shut down for the rest of the year, and many students don't have access to broadband or have a computer at home, so they can't do online classes or can't get to a place because of the stay-in-place orders that we have from our governor. So I think we need to look at that when we get back. I'm incredibly amazed at how the teachers, so many of them got out literally during spring break and put online classes together for our students. They really have done a remarkable job, but just a little overwhelmed. But I think we have a summer to take a look at that. In my own district, district, we're ready to go back to work, Chairman Scott. We have, in the entire 1st Congressional District, we've only had 284 cases positive of COVID. We've tested in the state of Tennessee almost 180,000 people. To show you the economic impact it's had on us, our hospital system here has 21 hospitals in Southwest Virginia, your great state, and Northeast Tennessee with 2,087 beds. We have exactly 12 patients with COVID in the hospital. We have a 33% occupancy rate. We lost $50 million last month, and we've furloughed over 1,300 people. My own medical practice has furloughed 200 out of our 850 employees. So we need where we are to get back to work, and the country is very different. Obviously, New York has been incredibly hard hit, as have some areas in Washington State, California, New Jersey, Massachusetts, and those places I think are much different than rural Tennessee. We're beginning to open up. People have done an incredible job of distancing and face covering, and the churches have done a good job of not holding services and won't until probably the 1st of June, just to be safe. So I feel good about us opening up. There are many parts of the country that will be different, however. One comment Chairman, I want to go over. My son lived in Illinois for 20 years after college and still has a business there. I have no interest whatsoever in bailing out a state. If you look at their pension fiasco that they have in that state and the enormous amount of money the retirees get, I don't want to be part of that. I want to help where the money is needed, and we'll certainly look at that. But I think we have to look at that with a microscope, with all due respect, because some of these states in Tennessee, we have one of the best funded pension plans in the world. And I know, and we're not a wealthy state, as you know, but we've been very prudent with our money. We had a rainy day fund of $1.5 billion that we're using now to help our state get back on its feet. I really look forward, Mr. Chairman and Ranking Member Fox, to getting back next week and seeing you all. I wish everyone to be safe, careful, and I look forward to seeing you. With that, I yield back.
Thank you. Thank you, Dr. Rowe. You mentioned coming back next week. It's my understanding that the majority leader called us back for next week, but the attending physician recommended against it, and the majority leader changed his mind. So were you saying that we're coming back next week?
I guess it's a week from Monday, I guess, Mr. Chairman.
Okay.
Yeah, thank you for correcting me on that. I'm ready to get out. I'm like you and the rest of us. I'm ready to get out of this house and get back to work.
Sounds good to me. Gentleman from Arizona, Mr. Grijalva.
Thank you very much, Mr. Chairman and Madam Ranking Member. Thank you very much for this opportunity. In Arizona, and in particular in my district, we all have wonderful and inspiring stories about how people have reacted and people have in the community have pitched in to deal with this pandemic. And the stories in Arizona are no different. The volunteers, the people taking meals to senior citizens at home, and the essential workers that continue to make the fundamental wheels of our community run. And those have been ongoing. But I think also I think it's no surprise to any of us to come to fully realize that the process and this very necessary response to the pandemic, the restrictions that have been put on our social life, distancing, the closure of businesses and schools, saving lives costs money, and the consequences are economic. And they're, 500,000 people applied for unemployment and going up in Arizona, more so in my district, which has a higher rate than any of the other congressional districts in the state. I mention those things because I think as we prepare the next package, and I agree entirely with the point that the chairman made, that these are relief packages. These are to stabilize and to minimize the hurt in our country, economically and health-wise, and they're necessary. And it's a prudent and intervention on the part of the federal government. and we're the ones that can do that. And our positions now are such that we are the first responders in terms of resources for the American people going forward, and we should do that. Student access, big issue, and I think as we talk about the package, the state and local stabilization package, it's essential that be part of any support for the American people, and certainly in my district. The leaderships at the city of Tucson, where I'm at, in Nogales, in Somerton, and other communities that I represent, has been outstanding. They continue to try to do what they can with their resources, more and more putting themselves in a deficit position going forward. The county and the response by the health department has been proactive and necessary. Saying all that, I think the next package has to include some robust funding to stabilize those communities, and in particular in our areas, having to do with worker protection and worker economic relief that I think is essential. In the schools, it is public education shouldn't be left out of the stabilization package. One of the things that this pandemic has done for all of us, some of us were not surprised or astounded by it, but others were, is that it opened a portal to look at the disparities that we have in our public school system, with the things that school districts had to go to, and the wonderful job that our educators and school personnel have done to bring meals to kids, to continue to provide nutrition, and to do the distant learning that is so important, to keep our kids on a path to success. But we discovered the digital divide. Some discovered the fact that the essential technology and the laptops and necessary for that learning experience online, families didn't have that. We discovered that the meals were essential to some of our poorer communities. And so I think the stabilization fund has to acknowledge that disparity and that reality, and provide the resources for it. Community colleges and training the workforce and reentry programs are going to be vital, and the public universities, such as the University of Arizona, whose research efforts at this point dealing with antibodies and tracing are going to be essential going forward, continue to need the support. In terms of workers, the mechanism to making sure that we make them provide some economic security for them in terms of their basic needs of shelter, food, and the protection of their families is essential. And how we work that mechanism, I think, is the next part of the discussion. OSHA, the chairman mentioned that. We're making special OSHA guidelines right now for the in response to the executive order by the administration to put the meat packing, pork, poultry, and pork packing industries back online, despite the outbreaks in those particular industries. And I think that kind of response in terms of making sure that those workers, and I'm talking about the sanitation workers, the custodial staff, the farm workers, the school janitors, and everyone else that's on the front line, and that does not exclude the health workers and the first responders, of course, and the telecommunication workers, that there has to be protections afforded to them so that as they do their job that they're required to do, they are not jeopardizing their own families when they go home from work. I think those are the things ahead of us, but I think the state and local stabilization with a big definition for public education needs to be the next package, and needs to be robust. And we have to understand that this is not a wait and see process. This is not roll the dice and see what happens when we open up. The baseline data that's necessary from testing is still a must. And going forward, I look forward to not only to telling the stories of good work that's being done in all of our districts, and it is good, patriotic, humanitarian support that's going on, but also looking through that portal and seeing those issues that we need to address, because any slippage, any going back is going to aggravate what we've already seen as disproportionate problems and challenges that we face. And I think this next package has to address those as well. And thank you again, Mr. Chairman and Madam Ranking Member, for this opportunity for us as members to have this hearing, this forum, in order to be able to discuss those issues. Thanks a lot.
Well, thank you very much. Gentleman from Pennsylvania, Mr. Thompson. Gentleman from Michigan, Mr. Wahlberg. Gentleman from Kentucky, Mr. Guthrie.
Hey, thanks, Mr. Chairman. Can you, you can hear me?
Okay,
All right.
I got you.
Thank you very much. I'd say thank you so much. Thanks for hosting this, and thank you for Republican leader Congresswoman Fox for putting all this together and letting us be able to share. First, I just want to iterate that I do believe that we should kind of set the standard and the House be back in session so people can see the country is opening again. But I want to stress, I've heard a lot of people say, colleagues, both sides of the aisle, that we should be in Washington, D.C. We're not working. Well, I know everybody on this phone call is working. And so I want to stress that we don't set the impression just because we're not sitting in the House chamber, we're not working hard. I think a lot of us probably worked harder than we worked over the last month just with phone calls and helping people with the crisis of their lives. So I just want to stress that. One, I remember when I first got back and thought the school system had shut down. I saw buses go by, and I realized that they were they were not hauling young people, they were hauling food and delivering food. So in Kentucky, our bus drivers have been delivering food, which opened up a new issue that they never had to face, superintendents, is PPE. So we always talked about PPE with at the very early part of our healthcare workers and people in the healthcare business, but we also had to struggle to find PPE for people who never used it before, our bus drivers delivering out in the public. So we worked through that. A couple of things I just want to address, I don't want to use all my time, is one is childcare. Before the businesses really shut down, our school system here has shut down, and a lot of the childcare had shut down. So a lot of employees were not able to go to work because of childcare. So when we get back, we're going to have to think about this. When school systems open up again, that'll take care of some of the problem. But throughout the summer, if your child, or when it first happened, when your child was not in school, nor were you able to find a professional daycare place for them to go, or the daycare shut down, it really put stress on people being able to go to work. The solution to that's not easy, but I know that our childcare providers are essential, and we need to think through that. It's been touched on the digital divide and rural broadband also serve on energy and commerce. So I know if we look at any type of infrastructure bill moving forward, or as we move money to the local school districts, or even the post-secondary school districts, we need to look that they have a plan to be able to make sure that they can provide distance learning and distance learning to be stressed. That's been a problem here. Getting people back to work in the workforce. I know we have 30 million people on unemployment now. I know there are a lot of people not going to work, but because they're on PPP. A lot of businesses said they're afraid when they do open up again, getting people back in and getting the jobs filled. So we need to look at, one, how do we get people back to work once we are opened up again, and look at that. And two, as some businesses don't open up and others change around and change the way they do business, how do we enforce our workforce boards for the education that they need for our workers to move forward? So one, we're being innovative. Our school districts are out delivering food, are looking at childcare. To sum up, we need to look at rural broadband and make sure that we have distance learning equal for all students, and workforce, and making sure that we have a way to get people back to work once we open up again. And for industries that may change, we have a strong workforce system so people can learn the skills to have not just a job, but a career. That's what we all want. And let everybody know when you talk about that we are all working, every one of us, and want to stress that. But I'm looking forward to getting back and seeing you all. So thanks, and I'll yield back.
Good. Well, thank you very much. Those are good points. Gentleman from Connecticut, Mr. Courtney.
Hey, Bobby, can you hear me okay?
I can, Joe. How you doing?
I'm good. So first of all, thank you to you and Ranking Member Fox for hosting this. To me, this technology demonstrates that we as a Congress can adapt to the situation that we're in right now, and I look forward to getting back as soon as possible. But frankly, once we are back in town, I still think that committee work is still going to have to be done with accommodations. Those rooms are just not big enough to really practice anything even close to social distancing. If you look at the British Parliament, which is the mother of all parliaments, they've been operating on a virtual basis now since the middle of April. And again, both of you deserve great credit for organizing this event. The state of Connecticut is actually a very hard hit state. The figures this morning show that we have the third highest rate per capita of COVID-related deaths, and we've got probably about 2,300 people that are hospitalized in the state of Connecticut. A dear friend of mine who lives about 3 miles from where I'm sitting passed away from coronavirus just a few days ago. So it's something that really, I think, has hit the state hard. I think we'll hear from our colleague Johanna Hayes about the fact that, again, this is striking very close to home for all of us. I just wanted to just kind of touch really quickly on a couple points. We have about 400,000 people that have filed for unemployment just in the last about 30 days, which is just, an avalanche. I think it really underscores the importance of Chairman Scott's point about making sure that we protect people's health insurance benefits. The HR 6139, which is the Worker Healthcare Protection Act, which is a subsidy program for people's COBRA benefits. In my opinion, that just screams out for immediate action. If we don't do that, we are just going to have a total collapse of employer-based health insurance. This is a proposal which is supported by employer groups such as the American Benefits Council, as well as labor unions, who recognize that there's just no way that people, even with these enhanced unemployment benefits, can possibly afford the premiums to get them through this difficult patch. We're not saving anything by not moving forward on this proposal. They're going to end up on public programs like Medicaid or subsidized health insurance through the ACA. We really should act quickly to make sure that, again, people's health benefits don't collapse. And again, the number of 30 million was just mentioned by Brett Guthrie. I mean, the fact of the matter is that, this whole system of health coverage is beyond being stressed. It's really in the process of collapsing. On the education front, I just want to say, again, we did good work, as Bobby said, in the CARES Act in terms of pushing money out K through 12. The Title I money is starting to hit the state of Connecticut. But frankly, there's other parts of the system that are also really struggling. Special education right now, particularly for young kids who are now cut off from a regular pattern of getting access to education. School districts are really struggling in terms of trying to get those services into people's homes. They are just burning through their budgets in terms of special education. And that really should be a priority in the next COVID bill in terms of making sure that the most sort of vulnerable and at-risk children out there are, at least there's a maintenance, which every school district, I don't care, whether it's low income or higher, really is feeling the crunch in terms of what's happening to special education in this crisis that we're living through right now. The workforce launch bill that Bobby talked about introducing here today, again, I think with the 30 million people out of work, we really should be using it, number one, as an opportunity to train people, low-skilled workers. You can do it remotely. I was on the phone this morning with a workforce investment board folks who have great models and systems to really help people hone and improve their skills so that as the country reopens, we actually are going to have a better positioned workforce to get back to work and contribute to growth, which is obviously the number one mission in terms of getting the economy working again. So again, I applaud his efforts to introduce that bill today. And again, it's something that really basically just funds the Workforce Investment Opportunity Act. Again, a bipartisan bill. I remember when Bobby and Virginia Fox were up on the stage there in the executive office building, when that was signed into law in 2015. I was in the audience there. Again, really what he's fundamentally looking to do is just to fund that initiative, because these are programs that work. And lastly, on the OSHA bill, which again, I think, we're dealing with a airborne pathogen threat, which requires really to have a national standard in place. It does not have to be onerous. It's not about punitive. It's about making sure that best practices are being shared out there with more than just a guidance, but with actually a national standard. And I would just say in my district, I have a shipyard, electric boat, 17,000 workers. It's staying open as a result of a critical infrastructure order from the Department of Defense. They really struggled the first couple of weeks in terms of trying to organize work shifts, density of workers. And I know Bobby's shipyard, you guys went through exactly the same thing. The fact of the matter is CDC guidelines, which is what they are implementing in these shipyards, which is what the OSHA bill adopts. They are workable, and they are about more than just PPE. They are about really just best practices. That bill will be a good thing for employers to be able to operate safely. And we did this with bloodborne pathogens when the AIDS HIV crisis hit in the early 1990s. Again, our committee, on a bipartisan basis with a Republican administration, moved forward with those standards. And that's really what we should be doing right now with airborne pathogens. And again, the roots of that initiative is very bipartisan and well documented and certainly precedented. So again, thank you for organizing this event today, to both you and Virginia, and look forward to seeing you guys soon. And I hope we continue this kind of work from a virtual remote basis. Thanks, Bobby.
Thank you. Gentleman from Alabama, Mr. Byrne.
Can you hear me?
I can hear you.
Thank you. Mr. Chairman, I want to thank you and Ms. Fox for putting this together. I think this is a good event for us to have while we're all working from our districts. And I want to emphasize, as Mr. Guthrie did, that we are working from our districts pretty hard. We passed the peak of this disease in Alabama 2 weeks ago. We've been blessed not to be stressed out by it. Our hospitals easily handle the caseload that we saw at the peak. We were blessed not to have a high level of deaths. We're projected to have fewer than half the number of deaths this year that we'll have from flu. Every death's a tragedy, but you have to count your blessings when we reached our peak and we didn't have the experience that so many places like Mr. Courtney's home state of Connecticut has seen. On the education side, Alabama ceased having in-school education in the middle of March. So children have been at home. They have been trying to learn distance-wise, and that's been a patchwork because a lot of kids don't have access to computers. In many places in rural Alabama, we don't have broadband. So I've talked to our state superintendent of education, and we got to address that somehow for the future. We have to expect that this is going to happen again. I am told by the state superintendent of education that he is intending to reopen the schools in Alabama in the fall. How they're going to do that, he's still working through. We probably won't have high school sports in Alabama this coming year, so no football on Friday night is going to be a real cultural change for a lot of people. University of Alabama system is opening again in the fall. Another question, can we open college football? No, college football on Saturday is going to be another cultural shift for Alabama. But I applaud the education officials in Alabama for the hard work that they've undertaken to try to keep things going when we had to send kids home. On the labor side, it's a tragedy. We've lost 420,000 jobs in the state of Alabama, 67,000 in my district alone. The vast majority of those people, Mr. Chairman, want to work. They do not want to be staying at home. They want to be being productive. And of course, the people that own those businesses want them back. So I think it's imperative that we work with our governors and mayors to start to reopen our economies around the country. Now, obviously, places like New York, Philadelphia, Detroit, New Orleans, et cetera, they're going to be on a longer path than the rest of us, but we need to start reopening the American economy. Our governor made a very tentative first step last night. We're no longer under a stay-at-home order. We can go to retail establishments. Our restaurants and bars are still closed. Personal services business like barbershops, et cetera, are still closed. But I think it's really critical for the people of America and for the future of our country that we get back to work. I'm disappointed in the way that the bills are coming down to us in response to the coronavirus. The second bill, which was one that dealt with leave, particularly sick leave, didn't go through regular order at all. I'm the ranking member on the subcommittee that has leave in it. I was never consulted one bit. So I protest the way that these bills are being put together. And the fact that we haven't been called back means that the Speaker and the Majority Leader don't think that Congress is essential. We are essential, and we should be there, and we should be doing our work. We did it last week. I testified before the Small Business Committee last week. I voted on the floor, as most of us did, last week. There are ways we can do this and still be healthy, and I think we should do that. A couple of things that I hope that our committee will look at as we go forward. One is I think we should be providing oversight to our part of the CARES Act. We need to ensure that our child care facilities are able to reopen in order for parents to go back to work. And I talked to some people in that industry recently, and they're facing incredible financial difficulties. I think we need to be working with our K-12 and higher education leadership around the country as to what they're going to need to reopen in the fall. And now more than ever, I think we need to pass the Education Freedom Scholarships and Opportunity Act. We have a lot of parochial and other private schools around the country that are facing closure, and this would help them. And we need to discuss ways to help our people who just lost their jobs get whatever skills they're going to need to get back to work. As I said, the people in Alabama who've been thrown out of work, they don't want to be out of work. They want to go back to work. Some of them are going to have to be retrained to do that. And I hope that we as a committee will look at that. Once again, I appreciate your doing this. I look forward to seeing you and everybody on the committee back in Washington soon, and I yield back.
Thank you very much. And your point about consultation and everybody working together, formulating the legislation, that point is well taken. We were rushing the legislation. We're passing major bills very quickly, and unfortunately didn't have time to go through the normal process. But that's the point of this call, to make sure that everybody has an opportunity to be heard. Young lady from California, are you there? Susan, okay.
We got it?
Yeah, you're there. You were there.
Okay, great. Thank you, Mr. Chairman. I know that I was certainly speaking initially about San Diego Unified School District, because one of the things that I want to acknowledge is that they actually formalized distance learning through negotiations and partnerships with the teachers and with their families. And so that was done, at great cost, as well as time and energy. And it tells us a little bit about what it's going to take to open the schools. I think the point that needs to be made is, in order to make our schools safe, and I've chosen to focus on pre-K to 12 as opposed to higher ed at this particular moment, is that we really need to understand, what does that mean to keep kids safe? Every student, every individual, every parent, every custodian, everyone who works on a school campus is going to be safe. And in order to do that, we have to put in place many, many different things. So it may mean lower class sizes. It may mean that we have to look at ways of really reconstructing the way kids learn in a classroom. The most important thing is that relationship, is that connectivity with their teacher. That's what builds good learning. And so that's going to be important as we're moving forward. And I think whatever we do, we need to be understanding that very, very seriously. And we also know that we need to negotiate that with our teachers. They have to be key in having the input to what's going to make them feel like they can go back to school and they can be comfortable. That may mean, in some cases, hazard pay. There are many different issues that are combined with keeping people safe. And I think because it involves everybody on that campus, we have to take special care to be able to do that. One of the things that we're always been aware of is that kids have a summer slide. I mentioned that earlier, and I think that by looking at this a different way in terms of the calendar, in California, they are thinking, well, if we start school earlier, perhaps that will be helpful. But that also creates other issues as well. And I know that we're going to be looking to how we do that, whether it's in shifts, how we're able to fund those smaller classes and what that's going to mean for children. I think the reality is, and I think the beauty of our committee is that we deal with so many of these issues that really matter to families and to children. And we also know that for many children, their only safe place is at school. That's not where they are right now. They're not going to school, whether they would have been preparing for the summer, but that has not become a safe place for them. We know domestic violence rates are rising, and that there are increased levels of trauma. Nobody wants to open the schools more than our parents, who took on many, many responsibilities, not just working from home for themselves, but assisting their children while at home. And that can cause all kinds of frictions. Any parent can tell you about that. So that's why I think we have to have an extraordinary push to be sure and get our children back to school safe. Everybody who works with young people to be in that same position, to have the confidence to go forward. And I think that this meeting today is a good start for all of us to begin to feel how we can do that. But the ultimate goal, of course, is to get schools open, have them functioning well, and more than anything else, close the achievement gap, which will be exacerbated by this great loss and this great trauma to our entire country. Thank you, Mr. Chairman.
Thank you. And we'll resume our list with gentlelady from Ohio, Ms. Fudge. Gentleman from Northern Mariana Islands, Mr. Sablon.
Hi, thank you. Thank you, Chairman Scott and Ranking Member Fox, for convening today's meeting. Good afternoon, everyone. It's really good to talk to someone that I know. Been here in DC for going on 8 weeks now. Our public school system budget has been cut by 68% due to the government revenue shortfall. And K-12 classroom instructions in public schools has been suspended since March, impacting over 10,000 students. Since March, teachers have not received 4 weeks and 4.3 weeks of their paycheck. Over 700 teachers and staff have been furloughed without pay. Many students do not have access to distance learning technology. We're working with our community college, for example, and trying to get a grant application into Interior for some distant learning technology. The U.S. Department of Education restriction on CARES college student aid has denied relief for students who have not filed FAFSA or are not eligible to file. And again, I'll go back over a month after CARES passed, the 4 U.S. insular areas, outlying areas, including the Northern Marianas, are still waiting for U.S. DOE to allocate CARES Act funding. 3 weeks ago, they said next week, and then last 2 weeks ago, it's next week, and then last week it was next week, and yesterday we were told next week. They actually put up online portal an announcement, guidance, and then they took it immediately down. So, Mr. Chairman and colleagues, in CARES to education priorities, the education stabilization funding should use Title I, a formula for the outlying areas as called for in a letter we sent to leadership, just so DOE doesn't have to go through the trouble of trying to decide, how to work on this. Additional funding to save teachers' jobs in the outlying areas, shorten the 30-day deadline for U.S. Department of Education to open applications for any new EDF funding, and earlier funding distribution. So earlier funding distribution could have avoided these teacher furloughs. The students were given we're given learning packets because, we have no long distance, no online learning. So students were given learning packets, and then now we have no teachers who will receive those packets and assess students' progress, their student progress. So yeah, I as in Congress Chairwoman Fox's letter that I co-signed, more funding for distance learning technology, more funding for minority serving institutions, and double max Pell Grant awards as co-for in Representative Alma Adams' letter that I co-signed as well. In healthcare, we have been blessed. Seriously, we have been blessed. Maybe because I'm still crossing my fingers. We have 14 cases, and out of those 14, 2 passed away. The 2 that passed away are actually missionaries that came on a visit to the Northern Mariners, to Saipan and Athenian. And they just came and then they got sick and passed away. The 12 have been cured, maybe it's the word I should use. So we continue, the public hospital has an estimated $50 million of needs related to COVID-19 expenses. Testing capacity is expanding, but the capability to conduct mass testing is not possible yet. The FEMA gave us a model, a Johns Hopkins model that says that in late May, early June, we should expect between 3,000 to 6,000 positives. But I don't say Johns Hopkins is not a serious institution, but that's a little bit, we're not there, and I hope that we don't get there. Government revenue shortfalls limit the government's ability to cover local matching funds for Medicaid. Please remember, we were hit with 2 typhoons and then the second largest storm in U.S. history since 1935. And then as we were just picking up, this happened. So Medicaid caps were increased by the Families First Coronavirus Response Act. And healthcare workers, we just learned yesterday, healthcare workers have PPEs now, but there is not enough available if a surge were to occur. Our PHCC, our main hospital, estimates that 10 patients would burn through the available PPE. And which is my beef with the Department of Interior, because they say that they are taking really good care of the territory. On the CARES to healthcare priorities, again, I would really like to see if we're going to have the Education Stabilization Fund, then okay, use the Title I formula. If we're going to have money to state and local governments, then we should carve out some of those money for education purposes. My governor just received $36 million, and he hasn't given the schools a dime. He's splitting the schools and pensions, the pensioner, the retirement program.
Ron, can you try to wrap up a little bit?
Yeah, okay, I will. On labor, again, look, it's been since some people lost jobs, and none of, we haven't received the recovery rebates. They said probably by June. Not on the unemployment assistance, they say probably by June. And so, people who come from a place who were, 725, it's tough. It's really difficult and it's expensive out there. So, Mr. Chairman, if the least I could ask for now is we've been trying hard and we have not been able to get there. I don't know what's holding up the money on the Education Stabilization Fund, but the teachers need to get back to work.
Well, thank you very much. Our next member is gentleman from Wisconsin, Mr. Grothman.
Yeah, thanks for putting this together. I will point out that we've already spent almost $3 trillion here. And I think a major goal from here on out is to find a way to maybe not spend more money rather than to think of all the new things we can spend money on. Quite frankly, I'm a little disappointed in this conference call with some of my Republican colleagues. All they can do is think of new ways to spend money. We love them all dearly, of course. I'll point out in education in my area, they're calling off summer school on both the university and the K-12 level. I'm not sure if that's premature, but they're doing it. So I would think most local school districts and states who operate these colleges without having summer school would have all sorts of extra money. We wouldn't have to give them more money. I also talked to someone for the local college. They're laying off all the janitorial and support staff because they're doing things online even now. So that's another way in which the colleges should have more money than they did before the coronavirus. And I don't really think we have to be spending any more money there. I do think we will have a problem with some people like childcare. We have a very generous unemployment benefit here, another $600 a month. And I know a lot of businesses are going to have a hard time getting people back to work. And I think maybe people on this committee, mindful of that, might weigh in with leadership on both sides. If there is going to be another bill, we don't want to create a situation in which people like child care providers, other employers in the district can't find people to work because they are on the unemployment. So hopefully we can do something about that. Just one more anecdote I'll remind this crew of. The last time we were in a crisis of unemployment of this great was the Great Depression. But there was quite a crisis that was not talked about 10 years earlier than that in 1920-21. And they were handled very differently between Herbert Hoover and Franklin Roosevelt. Herbert Hoover, of course, the very liberal Republican, Franklin Roosevelt, both greatly expanded government, and they wound up extending the Great Depression to be the Great Depression. Warren Harding in 1921 ignored the advice of his Treasury Secretary, Herbert Hoover, did not increase government spending hardly at all, and they worked their way out of that depression almost immediately. So just an historical lesson for us all, and just remind you all that the states have taxing authority as well. $3 trillion. I mean, we're going through almost $10,000, maybe $9,000 for every American for something that's only 2 months old. And I hope in the future we exercise a little bit of restraint. Like I said, I think both the K-12 and universities in my area should even be spending less money. And I think we can look at our own budget, and the states can look at their budget and maybe undo some of the increases that they put into effect the last 7 years of this expansion. Thank you.
Thank you. Next member is Ms. Wilson, gentlelady from Florida.
Which person is not like the others?
Gentlelady from Florida, Ms. Wilson.
I'm live.
Yep, you're live.
Thank you, Chairman Scott and Dr. Fox for putting on this meeting. And I just want to say to Representative Guthrie, this is the hardest I've ever worked in my elected career. I have conference calls with my state, my county, my mayors, my police, my hospitals, my caucus. It is something, but we're getting it done. And I just want to say to the members, please don't be so cavalier with this virus. There's fear, and there are some real experiences. I have 3 children, adult children. One is an assistant superintendent, and the other is a school principal. And then I have one that's a pharmaceutical representative, and she travels with her job. And she contracted COVID-19 and almost died. I almost lost her. She's 42 years old, no pre-existing condition. So this is real, especially for people who have to travel. So it's a warning. My state has been ravaged by counties, my two counties. I'm from Florida, and Broward County and Dade County has ravaged. We have a lot of cases, and we're in economic ruin. Unfortunately, the disproportionate impact of this virus will be felt for a long time after it ends, especially in Black communities. And I want to highlight a couple of statistics that illustrate the dire state that we're in and the consequences of addressing Black communities. According to the Bureau of Labor Statistics, Black boys and young men have an unemployment rate of anywhere between 20% and 32%, depending on what age bracket they fall in. I want to point out that these statistics refer to the first quarter of 2020 and don't reflect the full impact of COVID-19 on the job market. These numbers are going to get worse. We must step up and help marginalized communities recover from the pandemic with structural reform. And I have two recommendations. Number one, first, we must fully fund our schools so that post-COVID-19, they are strengthened and are able to carry out the necessary work of helping our children learn and heal. I fully support the recommendations of the Council of Great City Schools for an additional federal allocation of $175 billion in educational stabilization funds distributed to the local level, the Title I formula. I also support providing an additional $13 billion for IDA, $12 billion in additional Title I program funding. And I have a letter from the Council of Great City Schools that I want to submit for the record, Mr. Chair. Strong schools produce strong children, and we must give our schools and resources, the resources they need to develop our most vulnerable pupils. Second, I'm offering some legislation, and it's called the Youth Corps Act. And this critical bill would provide grants to states and local governments and nonprofits to carry out education and work training programs to low-income youth who are between the ages of 16 and 24. This is the group that has no health care. This is the group that lost their jobs. This is the group that did not receive a stimulus check. And this is the group that will probably be homeless before all of this is over. As a country, it is time that we start investing in these mostly Black young men and expand opportunities for our most vulnerable youth. Too often, the conversation focuses on criminal justice, prison measures, rather than creating opportunities to help you thrive. Prevention. I've had so many people call me about COVID-19 in prison, and it's just a conversation. But we need to have a conversation how to prevent people from going to prison. In Miami, I have a radio station. It's the same station that Tom Joyner was on for years and Joy Reid was on for years. And the one thing that people call in and want to know is, when is school going to open? And in Miami, we are the hurricane capital. In our hurricane capital, we know that I don't care what you do, the economy stays stagnant, everything stays stagnant until school opens. So until we can successfully open schools across our counties, across our states, and across the nation, we will be struggling. So we have to move carefully in order to open these schools. And as we plan, let us know that I don't want this to be a time that when vouchers will be strengthened. We have to keep our eye on public schools. And because public schools are a place of refuge during the times of crisis. In my district, we have served more than 1.8 million meals. They feed all children, including charter school children, private school children, and private and public schools received money from the stabilization fund too, but their kitchens are closed. So we have to protect our public schools and invest in them. And I would submit that we cannot leave our districts to fend for themselves during this critical time. My does not charge income taxes. Our economy rests on sales taxes. So when states don't get enough sales tax to balance their budgets, the first state budget they cut is education, not prisons, education. So we must pull together the best minds from our superintendents, our parent organizations, our public health officials, mental health officials to create benchmarks for schools as they begin to reopen. My two counties have tentative, robust plans for opening, including staggering the school day so the buses won't be crowded, so the classes won't be crowded, having some classes outside, a lot of ideas. And I want to have a round table with you, Mr. Chairman, with them to discuss these issues that they're putting forth, these plans. Providing clear leadership and expertise on the front end of this looming challenge will give parents, teachers, and most importantly, our children, the confidence that returning to school is not a death sentence. There's fear. People want to be sure when their children go back to school, they're going to be fine. And I want to give a shout out to the class of 2020 who missed graduation, missed grad night. They're not allowed, they won't be walking across the stage. They won't have their parents and family cheering for them. But we want them to know that we love them, and they're going to be a little petri dish experience as to what happens when school is interrupted for 6 months. We must act. Our children deserve the very best. And I thank you, Mr. Chairman, and I yield back.
Thank you very much. Our next speaker is young lady from New York, Ms. Stefanik.
Thank you, Chairman Scott and Ranking Member Fox, for putting this forum together. It's great to hear from all of the members of this committee across the country about how their communities are responding during these unprecedented times. New York has been the epicenter, and the impact has been felt across the state. The county public health officials and local hospitals in my district have been coordinating daily to track the impact on the region and ensure the public health needs are met. As we have seen across the country, there are also incredible stories of people and businesses going above and beyond to serve their community during these immensely challenging times. For example, in my district, Telescope Casual, which is a family-owned furniture business located in Granville, has converted their manufacturing capabilities to produce protective masks and then distribute them across the state, across the counties in my district, and throughout the country. In addition, on the education side, while our schools have been closed, our teachers and school leaders are doing whatever it takes to continue to reach all of our students. And I want to spotlight Washington, Saratoga, Warren, Hamilton, Essex County BOCES, which serves 31 school districts across 5 counties in my district, had superintendents, principals, teachers, and support staff all working over the weekend, initially right after the closures were announced, to develop both a plan for virtual learning as well as a plan to deliver and provide school meals to students. Due to their efforts, students across the region were able to continue learning and receive the nourishing meals the very first week of school closures. The state of New York is taking a regional approach to gradually reopening the economy. So we are relying on our public health officials in order to prioritize safety during this process. And expanding testing capacity is key in guiding our reopening. Some of the issues that have been elevated during this crisis include supporting rural hospitals who operate on razor-thin margins during normal circumstances and have truly been devastated financially over the past few months. Broadband connectivity and closing the digital divide has been a longstanding issue in our rural communities, and access to childcare options, which can be limited in small towns and rural communities. This will be critical as we gradually reopen our economy. Many of the policy areas in the education and labor space are front and center to this nationwide discussion, but I briefly wanted to mention two that I've been working on. The first is workforce development. As we know, the economic disruption caused by COVID has led to a staggering number of workers across the country losing their jobs and filing for unemployment. And as states are able to gradually reopen, it is critical to rapidly reconnect unemployed workers with jobs. So utilizing the existing structure of our workforce development system under WIOA and the expertise of over 550 local workforce school boards will help our communities meet this need. Along with the supplemental package that has been provided and will be considered in future packages, I believe we should look to provide temporary flexibility so local workforce boards are free to direct more resources toward work-based learning, which will provide an immediate bridge back to full-time employment. The second issue is student loan relief. I believe it is critical to ensure we are providing students and borrowers the support they need during this time of economic uncertainty. And as we know, the CARES Act provided temporary student loan relief by suspending all monthly payments and interest accumulation for federally held student loans through September 30th. However, there are 7.2 million borrowers who took out loans under the old FFEL program, which was discontinued in 2010. Those borrowers are ineligible to benefit from this temporary relief since their federal student loans are not held by the department. Last year, I worked with a bipartisan group of members on this committee to introduce the Equity and Student Loan Relief Act, which simply extends the same student loan relief provided in CARES to federal student loan borrowers who have been left out. So this is about leveling the playing field for borrowers. I hope we can continue to work in a bipartisan fashion on this issue. Thank you again, Chairman Scott and Ranking Member Fox, for pulling this committee together. We have incredibly important work ahead of us to help families, businesses, and communities recover. And I yield back, Mr. Chair.
Thank you very much. Thank you. Gentlelady from Oregon, Ms. Bonamici.
Thank you. Thank you, Mr. Chairman and Ranking Member Fox, for organizing this forum. It's great to be together and to talk about these critical issues because we are in really challenging times. And Representative Wilson, I'm so sorry to hear about your daughter, but I'm glad she's okay. You know, families here in Northwest Oregon, like across the country, are facing so much stress and uncertainty. Our unemployment system, we've had more than 362,000 unemployment claims filed in Oregon in the last 6 weeks. Some people are still waiting to get benefits. We know that there are many frontline workers on the job who are still without access to that personal protective equipment. And it's been inspiring to see so many local companies stepping up. We have a high school student in Scappoose, Oregon, who's using a 3D printer to make face shields. But we still have needs here in Oregon and across the country for more PPE and also workplace standards. We're in unprecedented times, and we need to figure out what standards we need to keep people safe on the job and have that essential pay to recognize the risk that so many people are working in. And parents who still have jobs, who are trying to work from home, and their kids are trying to learn at home remotely. These equity issues that have been highlighted. I know Mr. Guthrie and others have mentioned broadband, Representative Courtney, special education. These are real challenges for families and for students and for school districts. And I've heard from small business owners. I've talked to so many, and I agree with everyone who said, yes, we are working hard, even though we aren't in the Capitol. So many small business owners, they're just heartbroken and struggling and trying to survive, but are forced to make layoffs, and they're starting to lose hope. So we have this economic hardship, and we have a lot of ways that we can address it to deal with individuals, workers, families, businesses. And our existing workforce system, our workforce boards, our labor unions, our community colleges and community-based organizations, small businesses, all those stakeholders, this is a really important system for rebuilding our economy. And as Chairman Scott said at the beginning, This is disaster relief. And to relieve the disaster that we need to invest billions, not millions, in our workers and our workforce system. Many people, when it's time to go back to work, they might find that their job is not there. They need new skills. So I recently led a bipartisan group in calling for a $15 billion investment in the programs authorized by the Workforce Innovation and Opportunity Act. Representative Courtney, I was at that bill signing as well with Chairman Scott and Ranking Member Fox. In fact, it was the first one I attended as a member of Congress. And I appreciate the support of my colleagues in this effort. And I'm really proud to join Chairman Scott today in co-leading the Relaunching America's Workforce Act to make these investments. This is going to help support re-employment, layoff aversion strategies, as well as upskilling and reskilling opportunities and employment services for displaced and dislocated workers. And we know there will be too many. We need to meet the scale of this crisis, and investing in our workers is an important part of that response. I've also been concerned about the significant effects of the crisis on our childcare system. I thank you, Rep. Guthrie and others for recognizing the importance of childcare. It's already been, even before the pandemic, unaffordable for too many families. There was already a vast unmet need before the pandemic. In my home state of Oregon, all 36 counties are considered childcare deserts. That means there's one spot for every 3 children who need childcare. And early childhood educators, those important workers who are pouring their heart and soul into caring for the next generation, oftentimes they're making poverty wages and they qualify for benefits. So what we need is to take an important step. Well, we did take an important step to fund child care and development block grants and Head Start. That's not enough. I'm glad I'm partnering now with our Oregon senators, Senator Merkley and Senator Wyden, and on the House side with Representative Catherine Clark, in advocating for additional investments in childcare in the next stimulus package. It's part of our basic infrastructure, and this is critical. If our families are ready to get back to work, and they want to when it's safe, they want to be safe, if they don't have access to childcare, this economic crisis will not end. And as chair of the Civil Rights and Human Services Subcommittee, I'm also working to preserve and strengthen those necessary wraparound services because too many people are in need. I had a great conversation yesterday with many of our community action teams here, helping the people who are really, truly struggling. And they shouldn't have to choose between paying their energy bill. I'm almost done, Mr. Chairman. And COVID-19. So I'm calling for an increase in LIHEAP, the Low Income Home Energy Assistance Program, to help people pay for their assistance bills and also expand that to other utilities. So in a typical year, LIHEAP only serves a fraction of the households eligible. This is not a typical year. More households will need that. I hope we can get that done. And I know that there's a mention of history. And I think at this point in time, we should remember what President Franklin Roosevelt said, that the test of our progress is not whether we add more to the abundance of those who have much, it is whether we provide enough for those who have too little. We must make this a priority. And as I close here, I do want to thank Representative Stefanik for bringing up the student loan issue. We also have oversight responsibilities. And just this morning, it was announced that the U.S. Department of Education is continuing to garnish wages from student loan borrowers in direct violation of the CARES Act. So we need to get to work and address that issue in our oversight responsibilities. So I look forward to hearing more from my colleagues. I'm grateful for bipartisan interest in addressing many of these issues and overcoming these difficult circumstances. And I look forward to us all being together again when it's safe. Thank you again, Mr. Chairman.
Thank you. Thank you. Gentleman from Georgia, Mr. Allen. Gentleman from Pennsylvania. Gentleman from Georgia, Mr. Allen.
Hello.
Gentleman. Hello.
Hello. This is gentleman from Georgia.
Gentleman from Georgia.
Yes, sir. Sorry, I thought y'all were going to unmute me.
No,
anyway,
myself.
Okay. Thank you, Mr. Chairman. I appreciate you holding this forum today. obviously, as everyone has expressed, this is an unprecedented crisis, and none of us have experienced this before. I think probably the closest thing to it was what our grandparents experienced. And, they really didn't have antibiotics back then. But it's still challenging and it's frightening, and it for many it's been very difficult. And certainly, we want to remember all those that have that we've lost due to this terrible virus. I want to also thank our front line workers, all of our healthcare professionals who have been in harm's way, working around the clock to save lives, and they have saved. Thank goodness we have a healthcare system that is unlike any in the world, and we are saving lots of lives. And there are a lot of therapies that we're working on, and of course we have a lot of folks working on vaccines, and that really is the secret to getting this under control. I'm so proud to be an American and see how we're coming together to work to defeat this unseen enemy. Like all of you, I am in constant contact with my constituents. The one thing that I've noticed about this process, and I think it's good, is that not only did we pass the law, but I feel like I've been on the front line implementing the laws and the funding. And in fact, we all have, because we've all heard from our mayors and our businesses and everyone else with regard to what the government is attempting to do and try to do to, number one, save this economy so that we can return to economic success, which will also help everything else. Businesses in my district have retooled, and their operations are assisting our communities. For example, Second City Distilling in Augusta, Georgia is making hand sanitizer for essential workers, and American Knits in Swainsboro, Georgia is manufacturing medical face masks and gowns. I'm proud of all of the schools in my district making sure kids are still learning at home and receiving a good meal. In fact, I watched my granddaughter's kindergarten graduation on Zoom this morning, and that went very well. And but obviously would love to have been there to hug her neck. Columbia County schools are providing meals to students through their grab-and-go curbside pickup program, and they will drop off if the family cannot pick it up. Bullock County schools are delivering bags of free meals to 73 locations on weekdays. The program will provide free grab-and-go breakfast and lunch meals to any child 18 or younger. My district is home to some incredible universities, obviously Augusta University, and their this medical school of the state developed its own COVID-19 test that yields results in 48 hours. And that testing was ramped up in mid-March, and has really helped us fight this in the 12th district. Anyone in the state of Georgia can use their app 24/7 and meet with a provider for free and receive an initial telehealth exam. Telehealth is the future. If necessary, the provider can make a referral for COVID-19 test at the closest drive-up location to the patient. The Dental College of Georgia at Augusta University is producing nasal swabs on 3D printers. These are just a few examples of how my community is supporting their neighbors. Now we must focus on recovery and getting Americans back to work and getting our students back to school. However, Washington cannot use this crisis as an opportunity to keep spending. As Congressman Grothman said earlier, we have spent $3 trillion. The worst thing we can do for our young people is to spend them into oblivion. President Trump and congressional Republicans are not playing these kind of games. We deliver results to the American people who have been harmed by no fault of their own, but the buck stops there. Americans are ready for life to get back to normal. It won't happen as quickly as we all would like, but it will happen. We will get through this because we are Americans. I am thankful for the tremendous leadership from President Trump, Governor Brian Kemp, and all of our mayors and our county commissioners in 12th District of Georgia who have done so much and all of our school superintendents who have made this the best situation it could possibly be. The one thing I know, as I said earlier, America is still a shining city upon a hill, and we will prevail by God's grace. Thank you, Mr. Chairman, and thank you again for holding this hearing today. And I yield back.
Whoops, gentleman.
Mr. Chairman, you're mute.
Gentleman from California, Mr. Takano.
Thank you, Chairman Scott, for hosting this virtual bipartisan forum while our country is facing the devastating effects of this pandemic. And I applaud the House leadership for working quickly to address the needs of the American workers, students, and public. And I also appreciate the decision of the leadership to listen to the very emphatic advice of the House attending physician and to delay our return to Washington. I can tell you that I agree with with Dr. Monahan's assessment that the most vulnerable part of coming back to Washington is when members are flying in airplanes. And as a member from California, I can tell you it's a 4.5-hour flight to DC and a 5-hour flight out of DC back to California. And the standards for wearing masks on those air flights have not been uniform. I do see the airlines moving in the direction of requiring all of the crew members to be wearing masks, but I think only JetBlue is actually requiring all passengers to do that. They are providing masks. And this gets to the issue of this committee's work in terms of how we set standards, OSHA standards, with regard to airborne pathogens. And as my colleague, Mr. Courtney, I think so eloquently and I think in great detail traced the bipartisan origins of this work to address workplace standards for airborne pathogens as one of the keys to getting the economy to get back on a path of opening up. We do need to address those OSHA standards in this next CARES 2 package. It's imperative that we focus on and include language to support our essential frontline workers. That includes our healthcare workers, our first responders, grocery clerks, grocery store clerks, delivery drivers, farmers, every essential worker out there helping us. And if we're trying to get manufacturers and shipyards back up back up to speed, let alone our packing houses, our meat processing centers, we have to have sound policies with regard to workplace standards, workplace safety standards. And I applaud the work you're doing on this issue, Chairman Scott, and your leadership in this area. I know you're being proactive. So I'm very sympathetic to the desire to get back to work and reopen our state and local economies. There is still so much more to do before we actually see the stay-at-home orders lifted in every state. And I'm dismayed that we see a movement among some states that think that we're different than other parts of the country. I think it's kind of an act of hubris to think that any part of this country is immune to a surge. Opening up the economy is going to mean travel is restored. It's going to mean that even though you think that New York is on a slower timeline to reopening fully, the whole country, based on the premise of freedom of movement, is going to be again subject to a resurgence of this virus if we don't aggressively seek it out. And we need a national strategy. A state-by-state strategy, I think, is confusing. It sends mixed messages. Here in California, Governor Newsom has created a 4-stage plan to transition the state back to normal life. Stage 1 of the plan requires that the state build up testing, contract tracing, PPE, and hospital capacity that we build up in each one of these 4 areas. And look, without adequate testing, let's not deceive ourselves into thinking that if we open up the economy, that businesses are suddenly going to, jump into the kind of activity they saw before this pandemic hit. Are we really going to see that a dental patient is going to want to go see the dentist if he or she thinks the dentist may be infected, or vice versa? You multiply that toward any number of businesses, restaurants, whether you'll see the clientele resume to where it was before, without adequate testing, without knowing that people who test positive are being traced, and we're adequately isolating people. Unless we get this in place in a rigorous way, we're doing a lot of wishful thinking about how quick this economy is going to get back. Let me I'll finish up quick, Mr. Scott. Let me talk briefly about students. I did have a chance to talk to one of my school superintendents. I'm happy to say that that I'm proud to have received in my district $54 million to help my schools of higher education in my district. I'm proud that we included temporary relief for borrowers with federal student loans through September the 30th. And in the package, we must continue to include relief for more borrowers, including those with Perkins loans and those with private student loans. And I think we really need to address those. I also think that we need to do a lot to help our schools and our teachers with curriculum development on online platforms. We really need to think through resilience to pandemics in terms of how our schools are able to adapt. But let's not pretend that that online education is really a substitute for especially our K-12 and undergraduate population. There's just no comparison between in-person instruction that cannot be substituted by online platforms, no matter how much we are able to help them. And with that, I'll yield back, Mr. Scott.
Well, thank you very much. Next member is the gentleman from Pennsylvania, Mr. Smucker.
Thank you, Chairman Scott, Ranking Member Fox. Appreciate the opportunity to come together in this way. We've heard many members talk about the work that they're doing throughout their districts. I know it's the same here. We are working hard to ensure that individuals and businesses can access some of the aid that we've been able to provide through some of the bills that we've done. I do think it's important that Congress continue to meet and operate effectively throughout this time. Certainly, we would like to do that in person, and in ordinary times, I think it's critical that Congress meet in person. The relationships built, the interaction, I think, is an important part of what makes Congress an effective body. But I will say this, I think that using tools like this to continue to operate is something that we should be doing. It's been over 50 years since Congress appropriated dollars to send people to the moon. We should be able to figure out how to operate effectively as a legislative body, even when we can't come together and do that face to face. And so I'm glad this is a step in that direction. So I appreciate you coordinating this. I know I'm spending a lot of my time throughout the days on Zoom and Microsoft Teams and other tools to provide these face-to-face interactions. So there's no reason we can't do that in Congress. I do want to start by thanking all of those really true heroes on the front lines, those in our hospitals, healthcare systems, our first responders, and then secondly, those in the food supply chain. My district is a significant ag presence, one of the top industries here. But it's people who are working at our producers, who are working at plants to ensure that we have the food we need, truck drivers, warehouse workers, all of those who help to ensure that the needs of our community are met, are putting themselves at risk to benefit people throughout our community. So I do want to mention that. There's a lot of talk about schools, and the situation is similar here in Pennsylvania, and in the district that I represent, schools have been closed for the rest of this year, or the rest of at least until June, both systems of higher education as well as K through 12. We're seeing that firsthand. My daughter is a senior at one of our great Pennsylvania schools, Temple University. She's finishing up her finals right now as we speak in another room in the house. They stepped up very quickly, as did schools throughout Pennsylvania, to ensure that learning could continue throughout this. And then the same, my son's a junior at a public school here, and took them a little longer to get up and running because they just simply didn't have the kind of experience that the higher education schools did, but they're operating very effectively as well and continuing to ensure that education can occur. Here in Pennsylvania, particularly the counties in my district, they've combined, we have had over 2,000 positive COVID-19 patients, and tragically, we've had over 150 deaths now. Those numbers are unsettling, but the good news here in our region is that the social distancing, which I think was very, very important, was successful. Because the past few weeks, it appears that the number of new cases is leveling off and perhaps even starting to decline. So clearly, our curve has flattened, as was the intent of social distancing. So I think it is not too early to think about reopening. And I don't think anybody believes that means that we're going to return to normal immediately. Or that we should even stop some of the habits that we've developed in regards to social distancing. So we're going to need to continue to follow recommended guidelines such as face masks, washing hands frequently, maintaining social distancing, and so on. But the world moving forward will look very different for at least the next year, maybe 18 months until we have a vaccine, than it did just a few weeks and months ago. And I believe the longer that we wait to start learning how to function under this new normal, the more economic harm and job loss American households will face. Of course, we've been talking about the workplace. That's one of the key places that it's going to be required to adapt to ensure that workers are safe. And I can tell you that many employers in my district, I've already mentioned some in the ag community and so on, they have pivoted to coming up with innovative ways to keep their employees safe while meeting production needs. We like to refer our district as America's snack capital of the world. We have many manufacturers, both salty snacks as well as sweets that have been essential in maintaining our food supply chain. And there's others as well whose work impacts many critical industries along the chain. And as I mentioned, I'm just grateful for all the work they've done to ensure that food is delivered safely, employee health is prioritized. And some of the things that these manufacturers have done is they've worked to ensure that they have the necessary supplies for their workers, provided masks, other equipment for employees in these facilities, and for when they go home. They want to make sure that they're doing all they can to minimize exposure for all the community, whether they're in or out of the workplace. I've heard from many employers who are implementing temperature checks. This is going to become commonplace, I think, as industries continue to open. They're posting information to identify potential symptoms to ensure employees remain healthy. They're providing them with paid sick leave. They're taking steps to physically spread out workstations and making the types of modifications that I think all employers are going to need to be thinking about as we're going forward. So I'll stop at that. I'm just really pleased to be part of today's conversation. I'd like to thank you again, Chairman Scott, for scheduling this.
Thank you very much. Next is gentlelady from North Carolina.
Thank you, Mr. Chairman, and thanks as well to the ranking member for convening the meeting today. North Carolina has been hit pretty hard. We have currently 10,509 cases. We've had 378 deaths in the state. In my district, we have a little bit over 1,800 cases and 49 deaths. So that's here in Mecklenburg County. On the unemployment end, in March, there was 11.8%, an increase in unemployment, 24,000 unemployed workers here in Mecklenburg County, and statewide, 935,000 applied for unemployment. We are experiencing, as many of my colleagues have said, and I agree, a true national emergency. Our economy is in free fall, and our hospitals are stretched to capacity. Our supply chains, from food to medical equipment, are experiencing unprecedented shocks. An unprecedented emergency requires an unprecedented response. And so I'm glad that we could put politics aside and pass 3 comprehensive relief bills and a 4th interim package to help soften the worst blows of this crisis. But we still had 3.8 million Americans apply for unemployment yesterday, and we cautiously await a report next week that may find our unemployment rate exceeding 10, 15, and even 20%. So we need further stimulus, as some of my colleagues have said, to help Americans get through this pandemic. This is not a partisan issue. This pandemic has no preference, whether you're Republican, Democrat, or whether you have no party affiliation at all. But at the same time, we need to ensure that as states begin to reopen, that our workers have the peace of mind that their workplaces are safe and that they have some recourse if their employer is not actively protecting their health and their safety. So I just want to take a moment to promote a bill that I championed along with Chairman Scott and Congresswoman Shalala, the COVID-19 Every Worker Protection Act. I mentioned this bill because at the moment we have an OSHA that's asleep at the wheel. They're failing in their responsibility to protect our workers. And the CDC has issued unenforceable guidance to govern workplace activities. And unfortunately, the Trump administration is relying on this guidance in order to keep meat production plants open, with several states following its lead. So we need kosher to pick up the slack. They've got to issue an emergency temporary standard that covers all workers, requires all workplaces to implement infectious disease exposure control plans to keep workers safe. Because I ask my colleagues, what is the use of reopening our economy if our workers are afraid that they might get sick and die? And after that, once we have workers safely back at work, they deserve a living wage. We're talking about people who are essential, then I think they need to be paid an essential wage as well as having essential protection so they can make their rent and put food on the table. And most of us are focusing on securing increased pay for our essential workers, and that's good and that's necessary. But we shouldn't just be having this conversation in the context of this current pandemic. People deserve a living wage at all times in all circumstances. So we can't allow the hypocrisy of advocating for increased pay during a pandemic for our grocery store workers, our meat packers, our nursing home caregivers, and then pretending that $10 or $11 an hour is enough at any other time. So I hope we can continue the conversation of raising the minimum wage to a living wage, or at $15 an hour, which is probably not a living wage right now, but I think we need to really consider that. Expand access to emergency paid leave. The Family First Corona Response Act was a great start. And so the law has exclusions for both large and small employers, healthcare workers, first responders. That's a large share of the workforce. So we've got to eliminate these exclusions to ensure that all workers have access to leave if they get sick. So I do want to just add that the law limits 12 weeks of paid leave to only those with children whose school has closed for or whose child care provider has become unavailable. So we've got to ensure that the workers can use the long-term paid leave to recover from COVID-19, self-quarantine, or care for a family member. Thank you, Mr. Chairman. I know I'm running out of time, but I appreciate the opportunity to put my words on the record, and I'll send the rest of it to you. But thank you to all of my colleagues, and I'm working hard at home as well, 7 in the morning to 11 at night. Thank you very much. I yield back.
All right, thank you very much. Gentleman from Indiana, Mr. Banks. Gentleman from North Carolina, Mr. Walker.
Mr. Norcross.
Wait a minute, we have a Republican next. Gentleman from North Carolina, Mr. Walker. Gentleman from Kentucky, Mr. Comer. Gentleman from Virginia, Mr. Klein. Gentleman from Idaho.
Thank you, Mr. Chairman.
Who's?
Yes, Mr. Chairman.
Okay, who is this?
Congressman Klein.
Okay. Ben, thank you. You're recognized.
Thank you, Mr. Chairman, for having this hearing, or this roundtable, as it were. Is a great opportunity for us to hear from our colleagues, get to see our colleagues again. It's interesting to hear how everything is going across the country, and get to exchange some ideas about how things are going. I want to join those who earlier thanked our during these trying times. Essential workers who are showing up daily are the people who make America great. As a country, we need to start putting plans in place to allow more Americans the opportunity to once again contribute to their communities by safely starting to open their doors again. Times like these call on everyone to make sacrifices and rethink the manner in which we carry out our daily routines. And it's imperative that all Americans take seriously their personal responsibility in flattening the curve. During these times, I've seen many in Virginia's 6th District step up to the plate to transform their normal operations into ones that can help combat the crisis. Last week, I had the privilege of touring Orvis's fulfillment center in Roanoke. Orvis has begun producing masks and is donating them to the rescue mission of Roanoke and other local nonprofits. I appreciate their and so many other businesses' contributions to the 6th District and the relief effort. James Madison University's nursing school up in Harrisonburg has donated a respirator and much of their PPE supplies that they would otherwise use during instruction for their nursing students to Rockingham Memorial Hospital to help them better care for patients during this time. They've also had many faculty members volunteer to be on reserve for the hospital should their service become necessary. We're seeing many community members pitch in as best they can, and they should be commended for these efforts. This committee has such an important role in combating this crisis through its oversight of education and labor policy. As lawmakers, we should ensure that we're evaluating all policy options for paving a better path forward for Americans. This includes looking at what regulations are burdensome and have been proven to be roadblocks in the way of allowing workplaces and colleges and universities to respond quickly and effectively to this crisis. College students are uniquely impacted by COVID-19. They've chosen to make their education a top priority in their life, so they can best prepare to be a contributing member of their community. With the college being so costly, many students are operating on thin financial margins, and they need answers to the future of their education. With some schools looking to move all foreseeable education online, there are questions about tuition adjustments and housing. Students need answers. Colleges and universities were established to educate and serve students. The school's first priority during this pandemic should be to continue to educate and serve their students in a fair and accommodating manner. They need to use the financial flexibility they have to put the students' needs first, like they were established to do. As this committee holds hearings on COVID-19 response, we should hear from both small and large colleges on ways that were most effective in meeting their students' needs and on how they are making decisions concerning the coming semesters. As a committee, we also need to use our oversight to ensure that federal money isn't going to line the pockets of schools with billions of dollars in endowments, while other schools are having to consider permanently closing their doors. Just today, in fact, Mr. Chairman, I introduced a bill to prohibit federal COVID-19 crisis money from doing just that. While we need to ensure that we have a quick response to this crisis as lawmakers, we still need to exercise our responsibility to spend the taxpayers' money responsibly. I'm encouraged by seeing communities in my district come together and how teachers are finding creative ways to reach their students, but there still remain many questions that need answers. We need to come together across party lines to get through this crisis. Finding these answers and solutions, as well as ways to reopen this country, shouldn't be and isn't partisan, it's American. And I want to thank you, Mr. Chairman, for your commitment to achieving those goals. And with that, I yield back.
Well, thank you very much. Gentleman from New Jersey, Mr. Norcross.
Thank you, Chairman Scott and Ranking Member Fox. Appreciate it. And I guess it's a great place to start to discuss where we are in New Jersey. Second hardest hit in the country with close to 120,000 cases and over 7,200 deaths. Tragic by any accounting. This is our storm. I hear some calls from my colleagues on the spending. Well, those who get hit with hurricanes time after time after time, those states continue to get funded. This is our hurricane. So as we go down this road, you have to remember that we are all in this together. We don't get hit by many hurricanes in New Jersey, but we come together as a country when they do hit. So let me just start out by thanking those frontline, those essential workers, the police, the fire, the EMS, the doctors and nurses, those who are keeping the hospitals clean, but also the retail clerks who are working in many cases without the protection needed so we can have food. For those utility workers who are keeping our lights on so we can communicate here today, we really want to thank them. Tuesday was National Workers Memorial Day, and what a time to have it, with so many of those who are dying from being infected on the job. Yet I hear a claim for immunity for employer. Well, I think before that conversation can even happen, we have to talk about PPE and standards. The idea of asking a person to go to work, putting their life on the line is one thing, but doing it without the protective equipment is no way to run a business and no way for employees to work. So I think any conversation immunity has to happen after we wake OSHA up and tell them to have standards. You know, the idea that our defense industry is continuing to work through all of this. I spoke to one of our defense analysts who says one of their work locations in the heaviest hit in, quite frankly, the world, northern New Jersey, what they have learned about keeping their employees safe. If they can do it, we can do it. OSHA has to step to the plate and issue those standards. That's incredibly important. And that's where we come down to, is it a workers' comp claim or is it a disability claim? I suggest to you today we can look at making every claim of the COVID-19 at a workplace a workers' comp. And we as the federal government should back that with dollars. Those protections are incredibly important, just as the idea of those who were laid off, close to 60 million Americans, the highest in our lifetime, need to have COBRA, need to have their health insurance. The idea of trying to pay for this while you're laid off is something that won't happen. And as was mentioned by my colleague Joe Courtney, is we're going to end up paying it anyway. So let's keep it the way it's going now. It's the most efficient way. One other issue that has to be put on the board is pensions. I was on the special committee with Chairman Scott on the multi-employer and pensions. It was bad then. It's getting worse now. But now it's not just the multi-employer, it's the public pensions. So we have to look at those. If not, those systems will collapse, making it much harder. I've heard many discussions today on the digital divide. What a problem. In my hometown, literally, corporate America is stepping up to give those laptops to the families who don't have those. Close to 15% of the U.S. population, according to the Pew Research Center, do not have access to the high-speed internet. We need to look at it. That is part of our infrastructure, and looking forward to doing something with that. So my message is simple. Respond to the health crisis to make sure those are getting the proper care they need. Relief to the workers and to the companies so we all can come back together. And certainly we must recover. I want to again thank you, Chairman Scott and Ranking Member Fox, for putting this dialogue together. I look forward to getting back to Washington and getting back to the new normal.
Thank you very much. Thank you. Next member is the gentleman from Idaho, Mr. Fulcher.
Thank you, Mr. Chairman. Pleasure being here. And just as a reminder to everybody, our state is just starting its, well, in the middle of its third year now as being the fastest growing state per capita in the nation. And so some of those dynamics is having an impact on how we're dealing with all this. We've had a mixed series of effects across Idaho. We've got a lot of space here, and that's a luxury that some areas don't have. And so there's parts of our state that have barely been touched by any of this. There's also some parts that, generally speaking, the urban areas that have been impacted significantly. So generally speaking, across the state of Idaho, we're taking precautions like everybody else. We're trying to be very mindful of this, but it's just following common sense. On the healthcare front, there's some positive news. We've migrated very heavily towards telehealth. Again, the fact that we've got so many rural areas has contributed to that. But most of our seniors now, right now, about 90% of the patient visits have gone to a telehealth type of setup. And that has just been a huge winner. And so can't say enough about the positive impact of that. And the stimulus dollars have really helped on that front. The PPP plan and others have helped us facilitate a lot of that. And it's allowed some of our hospitals, insurance companies to set up alternative locations and other venues to see patients. And so that's been a very good health. Now, we know that doesn't replace an economy, but it does help in the short term. And so another thing that's helped us a lot is we've got some short-term insurance plans that have been a bridge that are helping people go through this transition right now. About in March, April 2, we were at 2.6% unemployment. We're about 10% now. So it's had that significant jump, but those short-term plans has helped a lot. On the education front, once again, the growth is a factor. We've got a lot of people coming in. However, positioned reasonably well for it. The options around the state are reasonably good. We've got a great private system. We've got a great public system. We've got charters, magnets. Homeschool has been a real strength here for a long time. I think per capita, we probably have more homeschoolers than any other place. And they've got a very good series of networks that they operate with. We also have a lot of remote areas, and so broadband is absolutely key. With our K through 12 system, we've got good connectivity, but not necessarily good bandwidth. And so that's something that is a real need for us right now. We're trying to figure out creative ways to help fund that, but the technology is out there. In our state, too, about 2/3 of the land mass is federally owned. So there's a role for the federal government on that front. We're trying to leverage the appropriate means in order to get the broadband at the pace that we need it. But that's the challenge that's is not going to be relevant to a lot of states, but that's one that we are struggling with right here. So we know that the stimulus and these steps aren't a replacement for a free market. The sooner we can get things turned on, the better. We're taking those steps right now. But just in our state, those are kind of the high points, Mr. Chairman. It's trying to get our broadband to the speed that we need it. It's trying to get and maintain the school choice flexibility to allow some of these people in rural areas to do things in a creative fashion, but they're stepping up that game. And then there's another program that some of the members will recognize called SRS. That's a Secure Rural Schools funding mechanism, and because of all the federal land, we want to try to keep that in tune, because those federal land areas, there's no access to property tax. So, Mr. Chairman, that's a quick update from us. Overall, I would say the people in Idaho are responding really well. We've got needs, but frankly, I just, after hearing my colleague from New Jersey, things are going pretty well here. Thank you, Mr. Chairman.
Good. Well, thank you very much. Thank you. Gentlelady from Washington, Ms. Jayapal.
Thank you, Mr. Chairman, for convening this member forum to discuss the impact of COVID-19. We've now lost more American lives to this virus than American lives lost during the Vietnam War. And my home state of Washington was the original epicenter of this crisis when the first case was diagnosed on January 21st. My constituents are going on their third month without a paycheck. I am so proud that we have one of the finest public health systems in the country in my state, but it's under siege, as are our healthcare institutions, our economy, and the mental health and well-being of all of our constituents as they deal with the many issues that they face. So, Mr. Chairman, I urge that we in Congress think bigger and deliver even more of a response that matches the enormous scale of the crisis. Over the last 6 weeks, 30 million individuals have filed for unemployment, and millions more haven't been able to get into the unemployment to even file. 35 million people are projected to lose their employer-based health insurance coverage, joining the roughly 30 million that are already uninsured even before the crisis began. And according to a Gallup poll this week, 1 in 7 Americans with COVID-19 symptoms won't even seek health care because they're too worried about the costs. So we need to do more to ensure that everyone has access to the health services they need through reliable public health insurance programs. My Medicare Crisis Program Act would do this by expanding Medicare to the recently unemployed and Medicaid to the uninsured. In addition, it would prohibit cost sharing across private and public health insurance plans and billing the uninsured for any COVID-19 related testing or treatment. We have to ensure that every person has access to healthcare during a public health crisis. Now, let's be clear, mass unemployment is a policy choice. Other countries, from Germany to Denmark to Singapore to South Korea, have done this, made a different policy choice since the pandemic hit even. We should be doing everything we can to prevent mass layoffs and furloughs and people losing their employer-based healthcare. And that's why I've introduced a Paycheck Guarantee Act to stop the hemorrhaging of unemployment and to keep workers tied to their job. My plan is simple. The federal government would provide grants to cover workers' wages so that employers suffering revenue losses or shut down due to COVID-19 can pay their employees. This is far better than disconnecting workers from their jobs and healthcare benefits and sending them to file for unemployment. The money would flow straight from Treasury or the IRS or through a payroll processing firm, rather than using a network of banks that have left out communities of color, the unbanked, and many small businesses. And my plan would be retroactive to March 1st to pull people back into jobs that they may have already lost. This is both an economic plan and a public health plan. Job number 1 is to beat the virus. To beat the virus, we do need people to stay home until we have a strong testing, contact tracing, and isolation process in place. And we also need to be prepared for second waves of infection that could require reshuttering of businesses. For people in businesses to not feel the economic pressure to return to work, we need to guarantee paychecks and give businesses support to keep their workers attached to employment. In addition, we have to do right by our frontline workers who are providing essential services to our communities at great personal risk so that we can shelter in place. We've seen high rates of infection among these workers, including healthcare workers, warehouse workers, transit workers, food supply workers, postal service workers, and more. We need proactive OSHA standards, PPE, testing, and real safety standards, as well as hazard pay. And companies should increase transparency about workplace infections and deaths and adhere to International Labor Organization safety procedures. Finally, we need to help community and technical colleges, workers, and students. The CARES Act allocated emergency funds to institutions based on Pell Grant recipients and full-time equivalent enrollment. This formula massively undercounted community and technical colleges because students enrolled at these institutions are more likely to be part-time, and nearly 40% of community college students do not complete the FAFSA, even as a majority of those are Pell eligible. So we need to ensure that the next package addresses this discrepancy through a targeted investment in community colleges that will be the engine of our nation's economic recovery from this pandemic. Mr. Chairman, we're facing a crisis of epic proportions, and we're grateful for your leadership and others in the House on both sides of the aisle. But it's time for us to do the things that will help us to not only deal with the scale of the crisis now, but will also enable us to be competitive in getting back to work when the time is right. I look forward to working with my colleagues on the committee to deliver swift relief to people across the country. And I'm glad that we're holding these forums to show that we can operate remotely. Thank you, Mr. Chairman. I yield back.
Thank you. Thank you. Next speaker is gentleman from Kansas, Mr. Watkins.
Thank you, Mr. Speaker. In these trying times, one thing that brings me hope is hearing stories of heroic Americans. Every day, citizens all over the country are taking matters into their own hands to help others. Alan Kirby from Pittsburgh, Kansas is one such hero. Alan's been using his 3D printer to make personal protective equipment for medical professionals. He's already sent many to local, and others are following his lead. Todd Coleman, the president and CEO of Miller's Professional Imaging, has pledged to donate 5,000 face masks to local businesses. This Pittsburgh-based business has made thousands of employees all around Kansas better protected against COVID-19. Rayma Ridge, a disc jockey from Uniontown, put on a block party for her neighbors while abiding by all social distancing guidelines. She has also started to make face masks for essential businesses and medical personnel. Paul Fernkoff, a Shawnee County Sheriff's deputy, has teamed up with St. Francis Hospital to create protective masks. The hospital donated 2 3D printers so that he could ramp up his production. This illustrates the true sense of community in this time. Free State Brewing Company in Lawrence, Kansas is also stepping up. They converted their brewery and started making hand sanitizer for the community. So there's a total of 36 breweries across Kansas who've done the same. These are just a few of the examples of how ingenuity is part of the American spirit. Congress should learn from stories like these and search for new and innovative ways to serve the American people. We need to get back to work one way or another. If we want to reopen the economy, this comes to show the American people that it's possible through data, not arbitrary dates. I believe this can be done safely, and Congress should be at the forefront. I also want to commend Ranking Member Fox and Chairman Scott for their efforts with this forum, and I hope that we can continue the dialogue moving forward. Thank you. I yield back.
Well, thank you for those very inspiring stories. That's great to hear. Thank you very much. Thank you. Mr. Morelli is not with us. He said he would be introducing a statement for the record. The gentlelady from Pennsylvania, Ms. Wild.
Thank you, Mr. Chair and Ranking Member Scott. I assume I can be heard. Thank you for nodding so that I know that I am. I very much appreciate the opportunity for us to have this call, and I consider it one of my great honors and privilege to serve on this committee with all of you. And so it's nice to be back with you at this strange time. I'd like to associate myself first with the comments of my colleague across the aisle, Representative Guthrie. I appreciate his comments about the fact that we are all still working, most of us harder than we have worked in a very long time. And I've been welcoming the opportunity to have a great deal of constituent contact, not in the physical sense, but in the telephonic sense. And during this period of time, it's been very, very instructive to me. Over the past few weeks, I have heard from constituents throughout my district, throughout my community, many of whom are putting their lives on the line to save our lives and to keep our country running. I've had emails, phone calls, teleconferences, as have all of you, hearing from first responders and frontline medical professionals, from teachers, from small business owners, fronting their payroll costs to keep their workers afloat, from workers who are working to stock warehouses and deliver products for large profitable corporations, but who are not getting the basic PPE and labor protections they need to stay safe on the job. As their representative and as a member of this committee, I have pledged to carry their voices to Washington. I've talked to the teacher in Allentown who is working as hard as she can to conduct remote learning despite the lack of adequate support from the Department of Education, both during this pandemic and long before it started. Many of you may recall that I often mention the Allentown School District during our hearings, and that is because it is the most economically distressed school district in my congressional district. Chairman Scott has had the opportunity to actually visit Allentown School District, and I appreciate that he did so. But it's a school district where inequity prevails, especially as compared to our fairly wealthy suburban school districts. So the teacher that I spoke with deserves the support that she needs to do her job right now. And of course, her students deserve a school that is equipped with 21st century technology. Students across all of our communities deserve to know that their schools have the resources they need to succeed, regardless of their parents' income. And I really hope that this committee will continue to work on curing the inequities that exist between so many students. I've spoken to the professionals across the two outstanding health networks in my district, Lehigh Valley Health Network and St. Luke's University Health Network. I've spoken to nurses, lab technicians, physician's assistants, physicians, executives, custodial, and cafeteria staff. They are the pride of my community. They always put the most vulnerable first, and now they are looking to the government to make sure that we deliver on our fundamental promise to them, to support them on the front lines by supplying enough PPE, by making sure that all frontline health workers can receive the paid sick leave that they so need, so that they never have to worry about coworkers coming in sick. And we have to continue to put in place evidence-based policies to slow this epidemic so that we prevent our health systems from being overwhelmed. I am in a state where we have by no means completely flattened the curve. Our governor announced today that about half of our state, the western half, which does not include my district, will gradually start to reopen. We're doing the red, yellow, green reopening program. My district is still very, very much in the red portion of the state. The small business owners that I've spoken to in every corner of my community who are struggling to hang on after seeing the initial funding for PPP run out before their applications could be processed, they need to know that they will be supported, not just right now, but for the duration of this crisis and after, once we begin the work of rebuilding our entire economy. And then there's the woman who works one punishing shift after another in a warehouse in Bethlehem, who does not have the protection she needs on the job and who is looking for sustainable childcare solutions for her children. How about some help for us essential workers, she wrote to me in an email. She's right. We need OSHA, the Occupational Safety and Health Administration, to establish clear, enforceable protections for frontline workers during this time. These folks are sacrificing everything. But they don't just need our thanks. They need hazard pay. They need PPE. They need to know that we are on their side. And for our economy to continue now and fully reopen, our workforce needs access to high quality, affordable childcare for their children. Finally, I have to mention workers like Enoch Benjamin, who at 70 years old worked at a meat packing plant just south of my district and who tragically passed away from respiratory failure associated with COVID-19. Enoch was a union steward charged with responsibility for making sure his co-workers were practicing social distancing and using PPE properly. 17 of his co-workers had tested positive for coronavirus. This is a moment for all of us as a society to honor the sacrifices of workers like Enoch by affirming that workers' lives and safety are paramount, by demanding safe workplaces for our people, and by working together to root out these tragedies. Thank you, Mr. Chair. I yield back.
Thank you. Our next speaker is the gentleman from Texas, Mr. Wright. Gentleman from Texas, Mr. Wright.
Hello?
Gentleman from Texas, Mr. Wright. Gentleman from Pennsylvania, Mr. Muser. Gentleman from South Dakota, Mr. Johnson. Gentleman from Pennsylvania, Mr. Keller.
My next?
Stay present.
What's that?
Stay present.
Hi.
Mr. Keller.
Yes, I'm here.
Okay. You're recognized.
Thank you, Chairman and Ranking Member. Americans are the most resourceful, outstanding people in the world, and Americans always demonstrate that in the toughest times. In our fight against COVID-19, this truism is especially accurate for the outstanding people of Pennsylvania's 12th Congressional District. Whether it is one of our natural gas companies keeping food banks stocked, or restaurants donating meals to healthcare workers and first responders, I have been humbled by how our community has responded during this unprecedented time. Pennsylvania's 12th Congressional District is home to many terrific institutions of higher education. Well, they have all answered the call to help. I want to highlight the work of two of these schools. Penn State University, one of the best research and academic institutions in America, has partnered with local businesses in central Pennsylvania to use 3D printing to produce PPE for medical professionals and first responders. Pennsylvania's 12th Congressional District is also home to some federal prisons, and some of our brave corrections officers and staff went to the Bureau of Prisons and call to the hotspots to help fight COVID-19 and keep people safe. Upon returning home, Bucknell University has opened portions of its on-campus housing to corrections officers and staff who need to quarantine before returning to their families. Again, these examples are just a sampling of how our entire community has stepped up to provide their resources to fight this invisible enemy. I would be remiss if I did not thank the essential workers who have kept our country going. One group currently working that will help immensely during our economic comeback are the Childcare and Learning Care Centers across the United States. Together, Childcare and Learning Care Centers operate thousands of locations across dozens of states, including in Pennsylvania's 12th Congressional District. These facilities provide child care and learning services for children of frontline workers, allowing them to help in the fight against COVID-19. And we thank them for their efforts and for staying open during this difficult time. As we move into the recovery phase of this crisis, these facilities will play an instrumental role in allowing America's workforce to return to business. For their current and future efforts, it is my hope we can work to provide child care facilities like Childcare and Learning Care the needed flexibility and support. Across the country, from America's farms to grocery stores to hospitals to the truckers on the road, America's small businesses and the bankers processing paycheck protection loans, Americans have stepped up to keep our food supply open, families fed, and Americans employed. With millions of Americans working for their neighbors during this pandemic, it is shameful that Congress has not returned to Washington to work full-time on behalf of the American people. Congress has returned to session safely twice in the recent months to appropriate nearly $3 trillion taxpayer dollars to respond to this crisis. It is imperative that Congress work together to safely return to Washington to do the people's business and ensure that the money Congress has appropriated is spent properly and effectively. We have seen millions of Americans step up and help out during this crisis. Congress should follow the example of the American people, of these American heroes, and get back to work as soon as possible. Thank you, and I yield back.
Thank you. Next is the gentleman from California, Mr. Horvath.
Fantastic. Thank you so much for your leadership and belated birthday, Mr. Chairman. I hope you had a good birthday at home. This has been quite an time that we can kind of convene.
Josh, let me just say it on my birthday. I think I had 6 conference calls and a town hall meeting.
Well, that's like more birthday wishes than you get if you were in D.C. I mean, that sounds fantastic. Everybody's saying hi.
Yeah, well.
Well, at least you're with family and all the rest, and happy birthday. So I wanted to talk about something that's very near and dear to my heart, which is some of the workforce issues, especially healthcare workers that we've seen across rural areas in my state, in my area. I think this crisis really has shined a mirror on the problems that we have had for a long time. We have always had a huge shortage of healthcare workers in rural areas, but that is a much bigger challenge today in the midst of a public health crisis than it was even a year ago. But just to give you a little bit of context, we had 12 doctors that graduated from residency in my district last year. 12 doctors. 1 of them stayed. 11 of them moved away to work in private practice in a more urban area or in another state. And there is a big disincentive to practice medicine in rural California and rural Texas because those are the only 2 states that do not benefit from the Public Service Loan Forgiveness Program. 48 other states benefit from this program, where doctors and other healthcare workers can get the same loan repayment forgiveness that exists there to work in nonprofits in areas of need. But California and Texas, because of a regulatory issue, are the only 2 states that do not benefit from this existing program, which essentially means that we're telling doctors, if you want to go and work in a nonprofit in rural Nevada just across the border, then you get more support for that than if you work in rural California in my district, just an hour or 2 away. I don't think that makes a lot of sense. And there has been a bipartisan initiative to fix this. We included it with your leadership, Mr. Chairman, into the higher education reauthorization bill, which I was really excited about. This has support from everybody across the aisle. I mean, we had 40 members of Congress that signed my letter to the Speaker that encouraged her to include this piece of legislation in CARES 2. Everybody from Louis Gohmert to Ro Khanna and Katie Porter signed on to this letter, and it's co-sponsored with the leaders Joaquin Castro and Paul Cook. And I think that this is something that we've been working on for a long time. I would love to get it included in CARES 2 because I think that makes a lot of sense. And it's not a controversial piece of legislation, but I think it would go a long way towards making sure we're prepared, not just for this pandemic that we're in right now, but also for the one in the future. I think this has exposed the real challenges that we have in healthcare in areas of need. And I don't think it makes a lot of sense that we're telling folks that in California and Texas, they cannot benefit from the same program that has proven to be a fantastic success in 48 other states. So that's our big priority. And thank you for that. And with that, I'll yield back the remainder of my time.
Thank you very much. Gentleman from North Carolina, Dr. Murphy. Gentleman from North Carolina, Dr. Murphy. Gentleman from New Jersey, Dr. Van Drew. Young lady from Georgia, Ms. Macbeth.
Thank you, Mr. Chairman, and thank you to Ranking Member Fox for convening this forum today. Really, really appreciate this. It's an opportunity for us to really just be able to share what's happening and really try to talk to our constituents in this new forum. Here in Georgia, our daily report tells us that we have over 27,000 cases of COVID-19, and we've had about 1,140 deaths. And in this crisis, we have seen time and time again that, our everyday heroes really, truly live among us from every part of our community. We know that our frontline healthcare providers are working around the clock to treat our families. Our first responders, our grocery store workers, our delivery workers, and other essential employees have all answered the call to basically ensure that all of our Americans can access vital services and goods during this period. I know that I'm truly committed to strengthening the protections of these workers, as I know we all are. And I was pleased to join you, Chairman Scott, and the other committee members as an original co-sponsor for the COVID-19 Every Worker Protection Act. And this bill, we know, really strengthens OSHA's protections by creating an emergency temporary standard for our frontline workers. Now, we all know that we must first mitigate the virus in order to get the economy back on a very solid footing. However, we can't ignore the realities of those that are suffering from economic harm. Many in my district and around the country have been laid off or furloughed. And our unemployment claims in the United States have climbed to over 30 million, and that's just within the last 2 months alone. Now, we must face this problem head on, and I believe that we are. In the short term, I have co-sponsored legislation that will subsidize COBRA health coverage. And the last thing that we need is for people who are laid off to lose their health insurance during this pandemic. And this legislation provides critical help to people who have lost their employee-sponsored insurance. And I want to thank you, Chairman, for your forethought on this piece of legislation, and I'm hopeful that we'll be able to get it included in our next package. However, in the long term, we must do everything that we can to support those who have lost their jobs. Georgia alone, just within the last month, has lost over 1 million jobs. Therefore, we've got to work hard to revitalize those businesses and really make sure that we're protecting them, especially those that have suffered these great setbacks. By providing our workers with additional resources, we can help sustain our American families and rebuild our small businesses and stimulate our economy again. And that is why I have worked to become an original co-sponsor of the Relaunching America's Workforce Act, which will provide billions in funding to employers and also apprenticeship programs and state and local government to respond to these very unprecedented economic times that we're in right now. And while our frontline and essential workers have already continued to keep our society going, our students have also seen the world completely turned upside down, as many of my colleagues have mentioned earlier on this forum. And we know that students of all ages, they have been displaced in the middle of their school year. And it's just completely upending their normal routines and forcing them to adapt to what is now a new normal for them. And though we know that most institutions of higher education have the students' best interest at heart, we also know that we've got to hold accountable those who have not shown that this has always been the case. In the past 6 years alone, we've seen some for-profit colleges prioritize profit over our students. And though there are restrictions that have been put in place to limit who has access to higher education funding in the CARES Act, for-profit colleges still will collectively receive about $1.1 billion. And that's why I'm excited to be leading a letter with my colleague, Representative Pramila Jayapal, asking our House leadership to place further restrictions on the for-profit colleges funding in future COVID-19 packages. And lastly, while we're all here safe in our homes with adequate support and resources to carry out our day-to-day duties, we still have to be thinking about our fellow Americans who do not have that same luxury. So many people are not safe in their homes. They have been forced to remain under the same roof as their abusers all day and every day. In the CARES Act, $45 million was authorized for FIPSA and its related programs, and $2 million was authorized for the National Domestic Violence Hotline. However, that is not enough money. That is not enough resource. Domestic violence services have seen such an increase in requests that they have received since the beginning of March. And we've got to be able to provide more funding and resources for survivors and those vulnerable that domestic abuse. I'm just really excited that we're here. I do believe that we are really bringing a message of hope to Americans. More than anything, I have been completely inspired by the unity that has been demonstrated by our community and by our colleagues since we first began our national response to this pandemic. I have seen neighbors helping neighbors, and I've seen our colleagues just pull together to navigate new challenges. And I've heard from countless constituents who simply just want to know, how do I help? I know that we're facing a very stark challenge, but I believe in America and I believe in its people. And I know that together we are going to defeat this disease. Mr. Chairman, thank you so much. Thank you so much for your leadership. And I yield to the next speaker.
Thank you. Thank you very much. And that next speaker is gentlelady from Washington, Dr. Schreier.
Thank you, Mr. Chairman. I am just delighted to be with my colleagues to see you all again here in the Education and Labor Committee, even though it is virtually. And I know I speak for all of us in thanking the teachers all across this country who have stepped up to ensure that we do not falter in our responsibility to educate children, even during a pandemic. I have been so impressed by the ingenuity and the devotion of teachers across my district, including my son's own fifth grade teacher, Mrs. Silvers. In addition, Muckleshoot Tribal School was recognized by Washington State as an educational leader for their swift and effective response to implementing an effective distance learning plan in response to the COVID-19 pandemic. They created processes for mobile device distribution, services for students with disabilities, model lesson planning for virtual learning, and a troubleshooting guide. I do want to remind this committee that if we really want to support education during this pandemic, the number one most important thing we can do is to make sure we include generous support to state and local governments in this next relief package. That is where the vast majority of school funding comes from, and if our states don't have the revenue to support our schools, then we all lose. Now, the other issue I wanted to talk about today is national service. This is something that appeals to so many of us on both sides of the aisle as a way to better our country and in the process engender a deep sense of patriotism and camaraderie. Some think of national service exclusively as military service, but working on a farm is national service, and so is working in a food bank or teaching or delivering meals to seniors. And our country has a very significant need right now. We're in the midst of a pandemic, and it will be many months, likely well over a year, before our lives return to anything resembling normal. So the path begins now, and it starts with testing and contact tracing. We need to know who's infected, and we need to isolate them, figure out who their contacts are, and test and quarantine those contacts. Ideally, we'll go even deeper, looking for second-degree contacts. To do this well and to get us through this pandemic with the least damage and the least interruption to our lives, we will need hundreds of thousands of public health workers. Some states, such as mine, are already recruiting and training, but we need this to happen nationally and, frankly, globally. And that's why I am so excited to co-sponsor together with Mr. Courtney on this committee the Pandemic Response and Opportunity Through National Service Act. The idea is to redirect Peace Corps members, Fulbright scholars, and AmeriCorps participants who have had their programs canceled while recruiting thousands of others to public service right here at home. The bill will fund 750,000 national service positions over a 3-year response and recovery period. Up to 300,000 of those positions will be dedicated to the field of public health. Even before this pandemic, our public health infrastructure was lacking, but now we really need the public health manpower. With this program, we can train up an army of skilled public health contact tracers. These people will be responsible for testing, interviewing, contact tracing, isolating and quarantining, and supporting those who are being isolated with food and other necessities. They will build a national database with test results and will get us ready for the world's largest vaccination program ever. So what happens when we're past this pandemic? We expect that many of these new public servants will find a passion for working in the public health arena. So this is a long-term investment that will help move our country forward and make it stronger as we move past this pandemic. Robust public health infrastructure means more support for new parents, more robust immunization programs, dedicated resources to reverse the trend of increasing maternal mortality, support for those struggling with mental illness, and the human resources we will truly need to combat the opioid epidemic. In short, I am delighted to work with my colleagues and shore up a new national service program specifically devoted to helping our country through this challenging time. But even more importantly, my hope is that this program will ignite a passion for public health and public service, and that we will emerge from this pandemic even stronger. Thank you, and I yield back.
Well, thank you very much. Gentlelady from Illinois, Ms. Underwood.
Yes, Mr. Chairman. Thank you. Hi, it's good to see you today. Today's virtual committee forum is just one example of the rapid changes that our society has experienced in recent weeks and months. The novel coronavirus has upended our lives in so many ways. As of yesterday, more than 30 million Americans have filed jobless claims. And we know that that's an undercount because many people are still trying to access overwhelmed unemployment insurance systems. Small business has been the cornerstones of our community, and they've been forced to close. And at least 60,057 Americans, including 2,355 Illinoisans, have tragically lost their lives. Yet as coronavirus creates new challenges, it also sheds light on problems that predate the pandemic. Rising healthcare costs have long threatened access for individuals and families throughout my Northern Illinois district. COVID-19 has only made our cause more urgent, and our next relief packages need to include a range of healthcare protections and funding. Frontline workers need PPE. Our country needs to dramatically scale our testing and contact tracing capabilities. We need to ensure that everyone who needs a test and treatment can receive those at no cost. We must close the gaps in previous legislation to ensure that all veterans in VHA care will have access to preventive services like a coronavirus vaccine when one is ready without any form of cost sharing. And we must enact Chairman Scott's bill to provide full premium subsidies for COBRA plans to ensure that people who've been laid off or furloughed can stay on their employer-based plan without paying the higher premiums they may no longer be able to afford. But we can't stop there. We must keep an eye on the bigger picture. COVID-19 is a once-in-a-generation crisis that will change our world forever, but also a once-in-a-generation opportunity to catapult us into a stronger healthcare system for everybody. COVID-19 will lead thousands, if not millions, of Americans to join the ranks of the 54 million Americans whose pre-existing condition protections will be eviscerated if the Texas versus U.S. case succeeds. We need to continue the effort to roll back junk insurance plans that don't offer protections or access to needed healthcare. And we need to ensure that people who need affordable insurance can get it, not only through a COVID-related special enrollment period, but by reducing the cost of premiums for Affordable Care Act plans by expanding tax credits to more people and making them more generous. We must also protect the health and financial well-being of workers and families by expanding paid leave. Previous coronavirus relief packages provided critical paid sick and family leave for certain workers, but didn't go far enough. Too many workers have been excluded from these protections. I've heard from constituents in my district who've been forced to forego wages in order to stay home to protect their health and the well-being of their coworkers. This committee has fought to expand paid sick leave and paid family and medical leave to all workers, and we must continue to do so because no one should be forced to choose between their health and their job or choose between caring for a loved one and their family's economic security. Our essential workers form the foundation of our economy and are the front lines of our country's fight against the coronavirus, and the fight is far from over. Congress must act to provide them with the protections that they deserve, which will be necessary to defeat this virus and regrow our economy. Thank you, Mr. Chairman, and I yield back.
Well, thank you. Thank you. The gentlelady from Connecticut, Ms. Hayes.
Am I there?
Yep. You good?
Yep. Thank you. Thank you, Mr. Chair, for having this meeting. I guess much of what I wanted to talk about has already been said. I just want to highlight a few things. First, to echo what many of my colleagues have said, I, in fact, have been working very hard, as I imagine many of you have. And I just want to remind everyone that this idea that we can all go back to Washington and be working if we have our temperatures taken and certain precautions put in place, I would just ask everyone to just think about that and reconsider a little bit. My husband, who's a police officer, 20 years in our city, tested positive. So my whole family is quarantined right now. And my husband was asymptomatic up until yesterday. So he was out in the community and working and showing up every day. And under some of the things that we're talking about, he would have been someone, and I would have been in my car driving back to Washington, not knowing that I was putting my coworkers at risk. So it's just something to consider. I mean, there are some essential workers who don't have the choice to work from home. They can't, my husband as a police officer cannot conduct his responsibilities from home, but I can. We can still legislate, we can still find ways to work together without putting other people at risk. And I just ask people to think about that a little bit. Childcare is very important to me. I've heard many of my colleagues highlight that. So I hope that we consider something like that as we're moving forward. I'm deeply concerned about our students with special needs who still are not receiving services at home and what that's going to look like. I think Kim Schreier said state and local municipalities and many other people, but my state could potentially have to lay off 10% of their teachers if they don't get some type of funding or some type of support. And that's something that we really have to think about. It's interesting how we all come together during a pandemic, as we should. We all come together and everybody is saying, what can we do to support families and communities? But I think that should be our baseline every day, not just in the middle of a pandemic, because there's so much that we can be doing. I hope that anything that we do will support labor, workers, the people who have to go to work with protective equipment. This should be a non-negotiable. When I was Teacher of the Year, I did a lot of travel in sub-Saharan Africa and went to many facilities that USAID ran and looked at many of their education facilities. And I remember that one of their major concerns was not having some of the equipment that they needed in their medical facilities. And never in my lifetime did I think that I would be having that same conversation in the United States of America. I'm scared, guys. So I hope that as we are moving forward and we are drafting legislation, we are thinking first that this is a healthcare crisis. And until we deal with the healthcare side of this, nothing else matters. I have a lot more, Mr. Chair, but I'll just submit my prepared statement for the record. I yield back.
Well, thank you very much. And you know the committee's thoughts and prayers are with you and your family, and we wish you well. Gentlelady from Florida, Secretary Shalala. Gentleman from Michigan, Mr. Levin.
Yes, I'm here, Mr. Chairman.
Good. Okay. You recognize?
All right. You can hear me.
I can hear you. I can't see you.
Oh, hold on.
Okay.
Give me 1 second here. Wow, there we go. How's that? I'm not sure if you're better off for seeing me, sir, but there I am. Well, first of all, to Congresswoman Hayes, I'm thinking about you and Milford and your family, and I'll be praying for you, and I love you, and take good care of yourself, and thanks for sharing your story. I want to thank you, Chairman Scott and Ranking Member Fox, for bringing us together today. We can act remotely, electronically, to keep Congress doing our vital work of oversight and legislating, in addition to all the work we're doing in our districts. And it's just wonderful to hear my colleagues' voices and see your faces. And I hope all of you and your loved ones are doing well. Mr. Chairman, this pandemic has forced so many systemic issues into stark relief. And we have the privilege and the responsibility as members of this body to address those issues. I want to start with one that's top of mind for all of us: protecting America's workers. We have a duty to protect both workers' health and safety and workers' rights. On health and safety, we must make sure the provisions of the COVID-19 Every Worker Protection Act, H.R. 6559, which you are leading, are included in the CARES 2 package. The idea that millions of heroic workers in hospitals, nursing homes, grocery stores, pharmacies, meatpacking plants, and other essential operations have been putting their lives at risk without clear direction from OSHA on what is needed to protect them makes my blood boil. We can and must do better. In terms of workers' rights, last week I led a bipartisan letter to House leadership signed by 168 members calling for funding and a directive for the National Labor Relations Board to develop electronic voting in union elections. These procedures already exist and work well. The NMB has had telephone voting since 2002 and internet voting since 2007. Many NLRB elections have been postponed indefinitely. We face the possibility that others will be conducted in person, even in the middle of pandemic hotspots. The NLRB needs to obtain and use proven tools to protect workers' rights to organize and bargain collectively. I'm happy to be able to say that on May Day. I want to shift to education now, where this crisis has highlighted huge inequities. In Michigan, about 40% of students, perhaps 600,000 children, don't have the resources to connect to the internet from home. This will have lasting impacts on these kids who disproportionately live in rural or low-income urban communities. We need to address these immediate access needs, but we also have to understand that no single short-term solution like hotspots will provide reliable access to all students. We must make long-term investments in the infrastructure necessary to ensure that every household has internet access and students and educators have the training and resources to learn and instruct online. This is necessary for justice, friends, but also for competitiveness, American competitiveness in the world. Speaking of which, finally, I want to talk about workforce. I'm proud to join you, Chairman Scott, to introduce the Relaunching America's Workforce Act today. It's a necessary investment in our workforce and career and technical education systems. But I also want to underscore the urgent need for another investment expanding America's public health workforce. I've partnered with Senator Elizabeth Warren, and I'm working with the staff of the committee on a coronavirus containment corps, a plan to put in place nationwide contact tracing and a strategy to get that done. It's a plan to put Americans back to work, funding workforce agencies to connect unemployed Americans to contact tracing jobs and later to long-term employment. But this isn't just a plan to employ Americans doing contact tracing. It's a plan to restart our economy, because without a national plan to stop the spread of COVID-19, we simply can't hope to defeat a virus that jumps state lines with a simple ride in a car, plane, or train. The name Coronavirus Containment Corps, or CCC, echoes FDR's Civilian Conservation Corps, which put hundreds of thousands of Americans to work during the Great Depression. We must now use the same imagination that lifted our country nearly a century ago. And I look forward to working with all of you to do just that in the days and weeks to come. Just imagine 150 to 200,000 people doing case investigation and contact tracing, reopening and paying hotels to house people who need to isolate, helping restaurants get back in business by feeding these people. This is a patriotic and really a positive way to get things going again, and I'm very excited about it. I hope you all stay well, and I yield back, Mr. Chairman. Thank you so much.
Thank you. Thank you. Gentlelady from Minnesota, Ms. Omar. Gentlelady from Minnesota, Ms. Omar. Gentleman from Maryland, Mr. Trone. Gentleman, Mr. Trone.
Are you calling on me?
No, you're just about. If Mr. Trone doesn't answer, you're next. Gentlelady from Michigan, Ms. Stevens.
All right. Hello, Mr. Chairman. Thank you for your incredible leadership and dedication in this moment. I'm so grateful to you and your team on the staff of the Education and Labor Committee, and to our participatory colleagues on the other side of the aisle. This meeting has been informative and of great benefit to the American people. As you know, Mr. Chairman, we are in the middle of a global pandemic. This pandemic, the coronavirus pandemic, has hit Michigan and my congressional district particularly hard. And COVID-19 has taken the lives of nearly 3,700 Michiganders, and it has decimated our economy in just a matter of weeks. Cities like Livonia, Michigan are hotspots. This virus is in our nursing homes, and it is now a public health priority of the highest kind about how we protect and ensure everyone's safety. And this is one of the things that we recognize as with paid family leave, and why paid family leave is so crucial right now. We cannot ask Americans to choose between their paycheck, their health, and the health of those around them. In middle March, I was proud to be a part of passing the Families First Coronavirus Response Act in a bipartisan, bicameral way that was signed into law that expanded workers' paid sick and family leave. But I too was crestfallen that we didn't have the chance to do hearings or have all the input that we would have liked to, although the circumstances demanded that we act quickly. The floor was closed during that period, and the floor of the House has largely been closed for several months. And I also find this concerning and unfortunate.
and looking forward to the day in which we can operate and speak from the well of the House of Representatives, the most sacred space in our democracy, on behalf of our constituents. I believe that we need to continue to look into paid family leave. People were qualified for paid family leave, but we are not hearing that people are getting access to it. And my mantra throughout this entire pandemic, since it was declared, was that we are not going to let you fail, that no one is allowed to fail right now, and that we are going to do everything it takes to keep you safe. But that said, we need to make sure that we understand who is qualifying for paid family leave and who isn't, and look towards expanding it. We're looking to our essential workers and to all people who are going to be one day going back to work and making sure that they can prioritize their health and safety and those who are in their homes. Like many of my colleagues, Mr. Chairman, I am concerned about how we are going to restart our economy and support Michigan families in the long term while we continue to do the prioritizing of safety and health for all. Childcare is also essential for America's workforce. Parents cannot return to work without child care for their children, as my colleague, Congressman Bonamici, discussed, with more than 2/3 of American families with children under the age of 6 dependent on child care. Child care facilities must concurrently be up and running alongside the first phase of the reopening of the economy. Because they have been shuttered, they have lost revenues. Those incredible child care workers have been without jobs and paychecks, and this is a problem, and liquidity is a real consideration for us. I have heard from many constituents who are struggling to return to work because they cannot find child care, and unfortunately, many child care providers have experienced what I was just discussing, an approximate 75% drop in attendance due to state and local stay-at-home orders, resulting in closure of about 65% of programs. In fact, some of the largest providers have experienced an 85 to 90% decline in enrollment. So we've got to look this in the face, because I've heard they have till June. And if we're going to open up, we've got to do so safely. We've got to do so rightly, and recognizing that child care is very important. And sir, we thank you and the staff of the Education and Labor Committee for their efforts to expand and make child care affordable for all. And we're so proud of this committee's jurisdiction on affordable child care. As we look to CARES 2 or additional legislation to combat coronavirus and ameliorate the economic effects, we also should look at the impacts across all industries and workforces and discuss responsible actions for how to secure critical industries and jobs and the real estate assets that exist on Main Street and are critical public safety, to public safety and thriving neighborhoods. Just as we ensure that our country still manufactures goods, and particularly for those of us in Michigan, automobiles. We must place trust and patience in the science and the ability to collaborate and not create false villains among us. This is what I found when I called Michigan's grocery stores, which was my first call when this pandemic hit, that employers and employees were working together to create a safe and constructive environment. We do need to push for these standards. We do need to pass the Stevens-Pappas bill on essential worker protections, to create an interagency task force led by the Department of Labor, so that we can have these worker protections coming in real time through the Department of Labor in partnership with the CDC and FDA. This costs no money. It will help along with the safety standards that we're pushing forward with your work, Mr. Chairman. And finally, it is absolutely essential, and we thank you, Mr. Chairman, for your great patience. You're a pillar of that on this committee. But it is absolutely essential that we protect our retirees, those who continue to be left behind from recoveries of past. Retirees' benefits by addressing the multi-employer pension crisis and forthcoming coronavirus legislation. This was left over from the last recovery. It is something we need to do. It passed the House in bipartisan fashion. And as we dole out these trillions of dollars to ameliorate the economic effects, we cannot leave behind our retirees and the multi-employer pension. So just yesterday, I sent a bipartisan letter to you, Mr. Chairman, and to other leaders like Chairman Neal of the House Ways and Means Committee, Speaker Pelosi, and Minority Leader McCarthy, who, people who have been paying attention to this issue, obviously those on our side who have been incredible champions, urging a fix to our struggling pension plans that are being put under further strain from this pandemic. We cannot let our retirees down. We cannot let the American people fail. And I stand by you, ready to protect our workers and families and older adults as we continue combating this invisible enemy together. Thank you, Mr. Chairman. Thank you to my colleagues. And thank you to everyone who remains dedicated to organized labor, those who are standing on the front line, protecting the safety of every single hardworking individual. Thank you, and I yield back.
Thank you very much. Next is gentlelady from Ms. Lee.
Thank you, Mr. Chairman. I'd also like to thank the Ranking Member Fox and your incredible staff for putting this forum together. Certainly, we all agree that Congress has been working hard, even though we haven't been in Washington. And I'm glad that the Ed and Labor Committee is leading the way to demonstrate how we can continue to bring our members together to work, even though we're stuck at our houses in our respective districts. When we weigh the disruption of the coronavirus has caused, there is no arena impacted like our education system. In my hometown, Clark County School District, 320,000 students are now at home attempting to learn online. But what that means is an inequity in access. We now know that 100,000 students do not have access to a device, let alone the internet service. Almost 70,000 of them have been, we've been unable to contact them. So as we begin to look at how we evolve from this virus, I think making sure that we are addressing the inequity in access to our systems is so vitally important. I do want to commend our education staff, our teachers, our administrators who literally in the drop of a dime had to go from teaching in classrooms to online, and I commend them for their heroic effort in doing that. As we look at the impact that this has had across this country, in Nevada on March 17th, our governor took a tough decision in shutting down all essential businesses. What that meant for our state, which is so enormously dependent on tourism, is it blew an incredible hole in our budget. We have a $4.4 billion budget. We expect to see a $670,000 or $70 million budget shortfall just in this year alone, and close to almost a quarter to half of a budget shortfall, $1 to $2 billion in 2021. And when you think about the education budget comprising 25% of that, there is no doubt that we're going to see cuts in education as our state and local governments attempt to deal with these revenue shortfalls. But I also like to think, ask us to think about our university medical center, our police department, our Department of Aviation. When we say get back to work, I think we need to remember that that has a significantly different meaning for different parts of our economy. And so I urge all of my colleagues to ensure that we provide more aid to state and small and large local governments, and allow those entities to have the flexibility to fill in the revenue holes. I introduced the Coronavirus Medicaid Response Act, which will use automatic stabilizers to increase the federal aid for Medicaid, known as FMAP, based on the state's unemployment rate. Again, I urge my colleagues to support that and look at other types of stabilizers that many states are going to need, because this isn't about us as leaders saying we're turning the economy on, everyone back to work, all consumers back to consuming. It's just not going to happen like that. This is going to be based on individuals' comfort with getting back to restaurants and bars and gyms. And so we need to take that into account. The other thing I wanted to address is, and I wanted to thank you, Chairman, for introducing Relaunching America's Workforce Act. And I'm proud to be an original co-sponsor on that bill. This bill obviously will authorize additional funding, and with rising unemployment, we need to make sure we're providing funds for workforce development. And I'd also like to make a plug for making sure as we look into infrastructure as part of the recovery package, looking into clean energy jobs as part of that. And finally, before we start looking at CARES 2.0, I think we need to call attention to oversight. Collectively, this committee has done an excellent job at holding the current Department of Education accountable for policing bad actors, specifically for-profit colleges. I, along with Representative Rosa DeLauro, introduced the Protect Students Act to curb fraudulent and misleading practices that lead students saddled with debt and an often unsatisfactory or incomplete education. And I believe that for-profit colleges are set to receive about $1.1 billion in federal funding from the Higher Education Emergency Relief Act. Many of these for-profit colleges already enroll a significant portion of their student body in distance education. And the purpose of this fund was to help institutions facilitate the switch to distance learning for students in response to the challenges to COVID-19. Ultimately, we should be wary of steering dollars to institutions that don't need them based on their existing models, as well as their prior track records to helping students achieve their educational goals. And I also want to make sure that this committee exercises the highest level of oversight to make sure that the half of that funding that was supposed to go or is supposed to go directly to students in crisis actually gets there. Chairman, I thank you for your leadership. I thank you for drawing us all together for this forum, and I look forward to working with you as we help states and local governments in our education system crawl out of this crisis caused by the coronavirus. Thank you.
Well, thank you. The next speaker is a gentlelady from Massachusetts, Mr. Han.
Thank you, Mr. Chairman. And thank you for convening this virtual forum for all of us today. Like each of you, I've been working home from here in Massachusetts these last few weeks, doing a lot of virtual meetings, talking with doctors and nurses and other frontline workers, small business owners and employees, union workers and advocates for those who are unemployed and in need of assistance. Certainly our teachers, our school superintendents, and our community college presidents, as well as state and local officials. My priorities, several of which a number of my colleagues have already raised, have been informed by these discussions and what I've seen for myself around this district. As previously mentioned by my colleagues, I too support expanding funding for child services and providers, making greater investments in special education to support students with different needs as schools pivot to online learning, curriculum development and training for our educators, and addressing the racial and economic divide that ails our institutions and our healthcare system. Certainly enacting Butch Lewis and paid sick and family leave policies as well. Earlier today, I spoke with Lane Glenn. He's the head of Northern Essex Community College about the urgent need to close the digital divide, making that investment in rural and urban broadband, and ensuring that all students have access to online learning with Chromebooks, tablets, and hotspots when necessary. I've also connected with our community college and state university presidents here in Massachusetts who seek our help to make greater investments in Pell for students, put resources into our cyber and physical infrastructure, and prepare us for the post-COVID-19 workforce. As we address these issues and approach the next package, these stakeholders and institutions need our help to stay whole and emerge from this crisis in a better place. First and foremost, the next coronavirus package should cover COBRA for those who have found themselves out of work due to the crisis. At least 30 million people have filed initial unemployment claims since mid-March, more than 750,000 here in Massachusetts, and we should ensure that they aren't forced to choose between paying for their health insurance or putting food on their table. We should absolutely advance the chairman's Worker Health Coverage Protection Act to cover COBRA. The coronavirus has also demonstrated how vital our CAP agencies are and the fact that CSBG is their lifeblood. CARES provided $1 billion in CSBG and lifted the eligibility to 200% of poverty. This was extraordinarily important. CSBG has made an enormous difference in my district. After the 2018 gas explosions in the Merrimack Valley, the Greater Lawrence Community Action Council charged into action using CSBG funds to help those who had lost so much. Today, Community Teamwork Incorporated, which serves Greater Lowell, is using CSBG to help close the digital divide by ensuring low-income children can participate in distance learning while schools are closed. They're providing those children with Chromebooks so that they don't have to take their lessons on a mobile phone. But the demand for CSBG has soared. The Montechusett Opportunity Council, based in Fitchburg in my district, has served 6,300 families in just 4 weeks with meals. That is 82% of their average for an entire year. They need more reliable CSBG funding. So I would recommend that the committee prioritize the Community Services Block Grant Reauthorization Act, which would renew the CSBG program so that 1,000 CAP agencies around the country can continue to serve those in need. I also strongly support the chairman's COVID-19 Every Worker Protection Act, which would require OSHA to issue standards to protect workers from exposure to the virus. Last month, a whistleblower nurse by the name of Maria Cryer began sounding the alarm that the Life Care Center of Neshoba Valley, a nursing home in Littleton, Massachusetts, wasn't taking the necessary precautions to protect residents. Life Care Centers of America is a national network of nursing homes. The company's facility in Kirkland, Washington was one of the early COVID-19 hotspots. Back on February 10th, there were signs of a possible infection at the Kirkland facility, and ultimately 37 people there lost their lives. Nearly 2 months later, the same thing was happening again, but across the country in Littleton, Massachusetts. Unfortunately, like in Kirkland, the Littleton facility wasn't prepared, and Maria and 16 others have passed away. We've alerted CMS to the problem, but an emergency OSHA standard would be to everyone's benefit. We should pass the COVID-19 Every Worker Protection Act. I would also ask that the committee give consideration to the Equity and Student Loan Relief Act, a bill that Representatives Stefanik, Smucker, Adams, Lee, and I recently introduced. The CARES Act made significant advancements in providing loan repayment relief to student borrowers. However, it didn't provide such relief for the 7.2 million students with privately held loans under the Federal Family Education Loan Program. The Equity and Student Loan Relief Act would protect these student borrowers just as CARES did for those with federally held student loans. I would also urge consideration of a comprehensive expansion of AmeriCorps in response to COVID-19. We should put these volunteers to work conducting virus testing and contact tracing. I understand that Representatives Price and Matsui are currently working on such a bill with Senator Coons, and I would encourage its advancement. Finally, and I will wrap up, I promise, I would ask that the committee permit student borrowers in the Public Service Loan Forgiveness Program to continue to receive full credit toward loan forgiveness, even if their hours at an eligible employer have been reduced. They shouldn't have to delay their debt COVID-19. Thank you so much again, Mr. Chairman, and I yield back.
Well, thank you very much. Thank you. And the last speaker in this round is the gentleman from Texas, Mr. Castro. Gentleman from Texas, Mr. Castro. If he's not, we'll see if there's a minority member. Gentleman from Pennsylvania, Mr. Thompson. Gentleman from Michigan, Mr. Wahlberg.
Hi, Chairman. This is Congressman GT. Thanks.
Hey,
can you hear me?
Yes, I can.
All right. Well, thank you. I appreciate this forum, and I would just say, I certainly welcome this, and I would recommend anytime we see a disruption of our schedule, and even times when we have planned times when we're separated, like during that month of August, that not a lot, because I know we're all busy during those times, but it'd be great to touch base using this type of technology. That said, you heard from three of my great colleagues from Pennsylvania already. Hopefully, you heard with Congresswoman Wiles and Congressman Smucker about basically reflect on the incidence of this COVID-19 in their districts. My district or the 14 counties I represent are probably about 30% of the state of Pennsylvania, landmass-wise. Some of those I share with other members, 3 of those. But the bottom line, the point I want to make is, in that 30% of the Commonwealth of Pennsylvania, our COVID-19 cases, positive cases, are just a little over 1% of all the cases in Pennsylvania. That's saying, as I've always been my philosophy has always been, obviously, we need to do government that provides some flexibility and not cookie cutter approaches that impacts all areas, because different areas all have different issues, and it certainly does in this situation. That said, I'd like to encourage obviously, one of the things I would like to see the committee really embrace is flexibility and calling on the Department of Education to provide assistance and flexibility. I recognize that there are some districts that children are being well educated using online platforms. I think probably at best, a lot of my districts, probably 25% of my families, and this is data that I've gotten in discussions with principals and some superintendents, 25% of the kids have no connectivity. And of those, that remaining 75%, probably 30% of those do not have enough broadband width to support the online learning platforms that the state of Pennsylvania and others have come out with. And so I don't think we're doing an adequate job of educating a certain portion of our kids. Is my concern that that we're going to be promoting them to the next classes, and I think any kind of flexibility that we could provide so that in areas such as some of my counties that have had one case, it was weeks ago, anyone who was quarantined is no longer quarantined, that there is, at least from a federal perspective, we can encourage that flexibility. My second thing really kind of feeds into that. As someone who also serves on the Agriculture Committee and has responsible for ability for the Rural Utility Service, which is really about where the connectivity occurs in rural America, I think we have a great opportunity here. Our schools, elementary, secondary, and also our higher education sites are doing a great job of knowing where these students have connectivity for online learning and where they don't. And anything that we can do to support and encourage the Department of Education and for us to get that information, I think will help us in the shared commitment that we all have to make sure we have high-speed connections in the future and that kind of reliability for every home. Quite frankly, we don't have good data today. The FCC has not been able to do that under any of the administrations I've worked under, and as hard as they work. And I think we have some real-time testing now. You talk with your superintendents, they'll be able to tell you they've done phone surveys with every one of their students. Universities have done the same thing. And so I think we have a positive opportunity in a difficult time to give us a baseline to know where we need to invest in that last mile connectivity. Two bills that are related to labor, and I know they're not in our jurisdiction, but I would just ask for anybody's support. The one is the grocer bill that was introduced. Congressman Dwight Evans from Philadelphia is a co-sponsor with me on this. This is a bill that really looks to say thank you to those who are working in retail at our grocery stores and convenience stores. They're not at the top of the income chain, obviously, and these workers probably have more contact with the general public than almost anyone else because of the demand and the rush from the grocery stores when especially when panic buying has kicked in. This would just provide a tax holiday for those folks for February 15th, federal tax holiday, February 15th to June 15th. Just a way to say thank you to, the fact that they're coming to work when maybe their neighbors are not, and putting themselves in, on the front lines. There is another bill that's just starting to develop. Actually, we're getting ready to introduce, and we're working on co-sponsorship. The Ag Chain Bill would do almost the same thing, but it would be for those who are involved on the supply chain side of things, of making sure that we're getting what we need. I would also include under that, or not just the food processors, but we also brought in the pharmacy stores and the folks working in there. Obviously, they're doing a great job, and delivering warehouses and all those, make sure that we get what we need during this time. And then finally, and I know those are not within our jurisdiction, but because they are specific to labor and workforce, would anyone who would like to support those it would be appreciated. And then the final one is, and again, it's agriculture related, but quite frankly, is only in our jurisdiction, and that is when we do get our schools back. We have decimated when we demonized milk fat back in 2010 on this committee. And we know that the science today is completely opposite of the importance of a balanced diet with and access to milk fat. We have put the rural America into a spiral through the dairy industry as we lost an entire generation of milk drinkers. And as we look at any kind of any kind of an economic recovery package when it comes to rural America, when it comes to specifically the dairy industry, the science is all on the side of the whole milk for healthy kids. And again, that bill is entirely in the jurisdiction of our committee, and I would certainly really appreciate both hearing and support to get that bill marked up. Otherwise, we're going to lose a significant part of rural America's economy when it comes to that industry. If the science supported, I guess, ruining that industry, then that's one thing, but the science clearly does not today. And I appreciate the opportunity. I would also ask that whatever we're using for to manage these calls, that we may want to change companies. I've been on this call since before noon, and spent 35 minutes listening to music, trying to get waiting to be put on the call. So maybe we might want to look at whatever vendor we're using as well. So, Chairman, Ranking Member, thank you both.
Okay, well, I apologize for the hold. We sent out instructions that if you had problems connected, to call the staff people who could help you out on the technology. I think part of it is we're limiting people that come in to actual members or people we know who they are, so we don't get, I think the term is Zoom bombed. We'll find out. Yeah. We'll find out what happened in your case, so it doesn't happen again.
Yeah, not a problem. If we could just, because I like this format when we can't be together. So just obviously it'd be great if it worked without problems. But this technology is great while it's working. I understand that.
We're going to find out. We're going to find out what happened to make sure it doesn't happen again. So that's that. Thank you, GT.
All right, Bobby. Thanks a bunch.
Okay, let's see. Gentlelady from Ohio, Ms. Fudge. Gentlelady from Florida, Ms. Shalala. Gentlelady from Minnesota, Ms. Omar. Gentleman from Maryland, Mr. Trone. Gentleman from Texas, Mr. Castro. Gentleman from Michigan, Mr. Wahlberg. Gentleman from Indiana, Mr. Banks. Gentleman from North Carolina, Mr. Walker. Gentleman from Kentucky, Mr. Comer. Gentleman from Texas, Mr. Wright. Gentleman from Pennsylvania, Mr. Muser. Gentleman from South Dakota, Mr. Johnson. Gentleman from North Carolina, Dr. Murphy. Gentleman from New Jersey, Dr. Ben Drew. I think everybody's had an opportunity to speak. I'll call on our ranking member to see if she has any closing comments. Dr. Fox. Whoops, I didn't warn you. Is Dr. Fox still on the line?
Checking, sir.
Yes, I'm here.
I'm sorry.
That's okay. I was listening. I was listening. I am about to leave, go catch a plane, but I want to say that I appreciate all of our colleagues being on the call today and expressing their concerns. We all certainly have concerns about what's going on with this virus. I am looking forward to getting a lot more statistics on exactly where the major problems are. I think we'll learn a lot when we get the numbers about who's affected and how we can handle such a situation in the future, and how we can continue to handle these things in the future. I do want to say, Mr. Chairman, that I am very concerned with the amount of debt that our country is taking on, and my constituents are concerned about that. My colleagues say over and over again, we need to buy this, we need to pay for this, we need to give money for this. And I want to remind all of us that when we're talking about federal dollars, as I've said before, that is money we're taking from our taxpayers, hardworking taxpayers, and giving to others. Sometimes they're hardworking taxpayers too, but often they're not. And it is not manna from heaven. This is money, again, that only comes from taxpayers. And right now, we're borrowing that money. So everybody who's concerned about the younger generations and future generations need to be concerned when they're asking us to spend money, who's going to be paying that money back? And what impact does that have long-term on our culture? So that is a major concern that I have in the discussions here. One of our colleagues did say we need to get competitive again and get back to work. That is exactly right. But being competitive and spending money are not always the same thing. So I am concerned for any of my colleagues who have illnesses in their families. They certainly have my concerns. But I'm thinking about the whole population in this country and what we may be doing to the whole population and to our way of life. I'll continue to pray for all those who are ill and pray for their speedy recovery. And I'll also continue to pray that we have wisdom in terms of the decisions we make, and that we not make just short-term decisions, but think about the future and what those decisions we make today, what impact they're going to have for the long term in our country. So it's been good to hear what everybody has to say today, and I wish everybody well, and I look forward to our being together again in our committee rooms and in our offices. And I know people are serving their constituents. I am too. And we just all want to continue to do that. God bless you all. Thank you, Mr. Chairman.
Well, thank you.
Mr. Scott, if I may, apologies for the interruption. Hi, Dr. Fox. Hi, members. Mr. Trone is on the line trying to get in. He had a little difficulty, but he's ready to go before you close, sir.
Okay.
No problem with me. Thank you.
Gentleman from Maryland, Mr. Trone. Gentleman from Maryland, Mr. Trone. Is he unmuting? Is he muted?
unmute yourself from a phone, you need to press *6. I believe he's in the lobby now, sir. Give us one more moment, please.
Okay.
Mr. Trone, are you now on?
Mr. Chairman, this is David Trump.
Hello. How you doing?
Hi, Bobby. Yeah, we've had a tough time here going back and forth. Are you ready? Are you with me? Good stuff on mental health.
You recognized for 5 minutes.
Oh, great. Thank you very much, Mr. Chairman. Thanks for holding this forum and for giving us the opportunity to share what we're seeing in our districts. In the past 2 months, I've been speaking to school superintendents, college presidents, nonprofit leaders, business owners, labor leaders, hospitals, community health centers in Maryland 6. Each organization is facing its own challenges during this pandemic. But one issue comes up time and time again, and that's mental health. We've already had a mental health crisis in our country. However, this pandemic has exacerbated the issue, and social distancing measures made it even more difficult to get treatment. A new poll by the Kaiser Family Foundation found that over half of U.S. adults say that worry or stress from the virus has led to at least one negative effect on their mental health and well-being. 40% said it's affecting their sleep. 13% has increased their substance use. This effects are even more prevalent among our frontline health workers and their families, as well as families that have lost their income. It's important that we act now before more lives are lost. Educational leaders in my district are concerned about the effect of social distance will have on their students' mental health. Some schools have seen their students with accessing teletherapy if they returned home to a different state than the one where the school providing care is located. Community health centers and hospitals have seen an increase in anxiety among patients and providers. Substance use disorders and treatment facilities have had to close temporarily and creating a gap in access at a time when it's so imperative these people get help. This is affecting everyone, from seniors who are missing daily contact through Meals on Wheels to those who have lost loved ones and have not been able to grieve with their families. It's clear Congress must take urgent actions to make transformative investment in our nation's mental health care. First, I sent a letter to Speaker Pelosi outlining 20 steps Congress can take, from passing stronger enforcement mechanisms for mental health parity to increase funding for NIH behavioral health. I'm hopeful that this committee will be actively involved in an effort to reform and improve access to mental health care. Secondly, an effort with Congressman Denver Riggleman and Congressman Danny Davis to request $80 million for schools to link educational institutions with mental health agencies and $20 million for the National Child Traumatic Stress Network and the next COVID response package. We need to make sure we give families and communities the tools they need to mitigate the stress and anxiety caused by the pandemic on our most vulnerable population. Third, I'm proud to say that today, the first day of Mental Health Awareness Month, I've introduced the Confidentiality Opportunities for Peer Support Counseling Act, or COP Act, COP Counseling. This bill, which I'm leading with Congressman Guy Reschenthaler, will require confidentiality for peer counseling services for federal law enforcement officers. The bill also encouraged state and local first responder agencies to adopt peer counseling programs. We've heard this concern in our district from many, many law enforcement agencies. We'd also like to discuss the need for increased broadband. I've seen many organizations be resourceful restructuring programs for virtual education, medical appointments, addiction recovery meetings, but limited access to technology and broadband prevents these services from reaching everyone in need. That's why it's critical that Congress include the broadband proposal yesterday of Majority Whip Jim Clyburn to ensure every American has access to affordable, quality broadband. Lastly, Mr. Chairman, Congress should allocate funding to our institutions of higher education to support these schools and students. But the Department of Education's guidance on allowing uses of the funds are slow and confusing. We've heard from the colleges in my district, they're afraid to spend the funding, and they haven't. We've heard that to ensure that these institutions have a clearer and faster guidance, we need to respond quickly to support the schools and the students. I'd love to have this committee help us to work to address these concerns. If we don't take bold action now to address mental health in the upcoming COVID response package, our constituents will suffer irreparable harm. I will continue to work to make sure mental health support that our constituents needs. We need to do this, and I hope you'll join me. I yield back. Thank you, Mr. Chairman.
Thank you. The ranking member, Dr. Fox, said that, have you finished your closing comments? Dr. Fox?
Yes, she did, sir.
Okay, thank you. Okay, thank you. Well, in closing, I want to thank all of our members for participating. We got a lot of very constructive comments. One member, I think it was a friend from Alabama, pointed out that we hadn't gone through regular order through some of the bills we passed so far. I can tell you that those were appropriately rushed because of the emergency situation we were in and the disaster that had occurred all at once. We had to act quickly. We're going to try to make sure we have meetings like this so that all of the members can get appropriate input as we consider the next bill. But this has been, I think, a great opportunity for everybody to participate, and we're going to try to do this as often as we can. We had one suggestion that we do it during the August recess, but in any case, I think this has been a good afternoon. We expected it to go till about 4 o'clock, and we're just a little before that. So if there's nothing further to come before the committee, the meeting now stands adjourned. Thank you very much.